I'm going to call this meeting back to order. We're going to start with a roll call. Madam Clerk.
Good afternoon. Let the record reflect all supervisors are present, with Supervisor Adams, Alejo, Parker, and Phillips appearing via video conference, and Chair Supervisor Lopez appearing in person.
So to clarify for the public, the reason we're reconvening here at 1 o'clock rather than our typical 1:30 is we had some technical issues that we believe we've now hammered out, and so we're going to try to proceed with this meeting. We're going to go back and redo the approval of the agenda addition that we did at the top of this meeting, just to make sure that we're covered. Council, did you have some comments for us?
Thank you, Chair. I would just notify the public that the video of the meeting is streaming on YouTube and Facebook, as well as Zoom. And if you go to Granicus, the title page will have the information on where to log in to view on YouTube and Facebook.
Thank you, Council. So again, if you wish to watch the meeting, it's now available via the county's page on Facebook, as well as streaming on YouTube. If you wish to participate, we ask that you continue to use the Zoom line available on the agenda to call in and make your public comments when appropriate. At this point, we're going to go back to the approval of the agenda. And Council, could we actually, it was the clerk who read out those additions. Would you mind making those once again?
So there were additions and corrections to the calendar, and that is to add item 6.1, and that is to consider adopting a resolution authorizing and directing the county administrative officer to negotiate for and enter into necessary or appropriate agreements with the City of Marina and Joby Aviation for the use of land and facilities as the Marina Municipal Airport to provide space for or house persons infected with or suspected to be infected with COVID-19 and who require supportive care but who do not require treatment in an intensive care unit.
So the last time we did this, I had a motion from Supervisor Parker and a second from Supervisor Alejo. Can I get confirmation that those stand?
Yes, I move that this be added to the agenda today.
Second.
Okay. Can we get any public comment on this item? One person coming forward. Pamela Weston.
I have sent the Kings County, I've sent each of the division heads things from the Kings County Interagency on a Homeless Council.
This is a comment on this addition
right,
to the
and
agenda.
so for the land to be used for recovery and assessment and for shelter, I ask that they, as that they're doing the planning, that they can also look at the Interagency Council's recommendations that have been used in Kings County, Seattle, that I provided with the Board of Supervisors, Anastasia Wyatt, and all of the Health and Human Services Division. Thank you very much.
Thank you, Pamela. Okay, so can we get a roll call vote on that, please?
Supervisor Alejo?
Yes.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Lopez, Supervisor Lopez.
Aye. Motion carries. Thank you so much. At this point, we're going to head into our consent calendar. There were 2 items on that. Is there a member of this board who'd like to pull one of those items?
I just want to make comment on number 9 on the vote by mail.
Okay. Okay. Any members of the public who wish to pull an item? Seeing none, we'll bring it back. And Supervisor Alejo, your comments for 9.
Yeah, just a question for Claudio Valenzuela, if he is on the line. Just trying to see any conversations with our Secretary of State, Alex Padilla, or the governor, whether an executive order would be issued. I know we're making a request as a staff recommendation, but whether there's been any communication to signal whether this would happen. But by way of comment, I just wanted to say how important this was. Just a few days ago, we saw the major problems witnessed in states like Wisconsin in their primary elections, where there were long lines. People were turned away. It was hard to practice social distancing. So not knowing where California will be in November, in the fall, I think it was incumbent for us to really reach out to our state leaders, asking them to allow county governments to be able to institute all by vote by mail election. with drop boxes, secure drop boxes, and also added services from our elections office for special needs in our community. But we're preparing for the worst case scenario here. And I think I appreciate our elections office working on this for some time now, but now bringing it forward where we could act and try to reassure every voter that their vote will be counted, that it matters. And we will try to make it as easy as possible to exercise their right to vote in a critical presidential election. Thank you, Mr. Chair.
Thank you, Supervisor. I could not agree with your comments more, and I will ask to see if Claudio Valenzuela is available via the Zoom to comment on your question about communications with the state and the folks there who are going to have a big influence on where this goes.
Yes, I am in the call. Thank you, Chairman Lopez and Supervisor Alejo. And the latest and greatest is that basically there are several efforts by different groups of people trying to do practically the same thing. It's just that there's a few variations. One group is a group of counties like ourselves. Just a few minutes ago, the Contra Costa County Board of Supervisors sent a very similar resolution and draft executive order to the governor. That resolution passed by all members of the board in Contra Costa. And I think there's another county also going today to their board, and then a few more next week. So that's one effort. The other effort is from the California Association of Clerks and Election Officials. I'm a member of the board there, and also a resolution will be sent either today or tomorrow, the executive order, draft executive order will be sent either today or tomorrow to the governor as well. And then there is another effort by a larger group of folks. It's led by the Secretary of State. And also there is a potential executive order, draft executive order going to the governor by that group. I have been participating in those meetings as well. So very similar. I think everybody is in the same page. We're going to, everybody's suggesting the vote by mail. It's just a few differences on how to do it and to what degree we need to provide on in-person services. That's it. That's all I have.
Thank you, Mr. Chair. I did want to just reassure the voters of Monterey County that almost 80% of our voters, I think for the primary was 77.6% of voters in Monterey County were already at vote by mail, absentee ballot. This would extend it for the remainder of folks. And one additional change in the law prior to this crisis was the legislature had approved counties to be reimbursed for postage. So with an all by mail ballot election, no postage is required to turn in their ballot and get it to the elections office, or they have the option of dropping them off as well. So for all good reasons, I think I appreciate, again, your leadership, elections office director, for bringing this to us and allowing us to take some action today on it.
Thank you, Supervisor. Are there any other supervisors with comments on this item? Hearing none, I'll bring it back and ask for a motion to move consent.
So moved.
I'd love to make a motion. Yes.
I've got a motion from Alejo, a second from Adams. Roll call vote, please.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye. Motion carries. At this point, we'll head into item 6, which is a briefing and update on COVID-19, including the impacts and action proposals and plans to address COVID-19's impact on our community.
Thank you, Chair Lopez and board members. We have, as you know, an extensive effort underway to address the COVID-19 impacts in Monterey County. We have I'll start over. Mic not on? Yeah, okay. How's that, Valerie? I don't think it's turned up very much. Is it really? Okay, I'll talk louder. Thank you, Chair Lopez. Just to back up for a second. So we've been working, as you know, very hard at addressing the COVID-19 impacts. We have a terrific team of county staff and other individuals who are working very hard as a team to try to address this emergency. We wanted to give you a fairly extensive update today on a number of topics, and let me just quickly go through what they will be. We have individual presenters for each topic. Dr. Moreno is going to talk about the current status of testing. Christy Michi, the epidemiologist from the health department, is going to talk about modeling to predict the virus spread. Gary Millay, our emergency services manager, is going to talk about the care and shelter plan update, give you an update on that. Dr. Craig Walls from the TIVDAD is going to give you an update on the alternate care site discussions that we've been having. And I believe Dan Coughlin from Joby Aviation is going to join us as well, who is very involved in that particular project. Mike Durr, our purchasing manager, is going to talk about the PPE ordering status and how those devices are being deployed. Dr. Gray is going to talk more specifically about the PPE situation at the TIVDAD Medical Center. And then small business assistance discussion will be held with Kimberly Craig from the Business Council, Lee Takakawa from Cal Coastal Rural Development Corporation, and Chris Donnelly from our Workforce Development Board. I reached out to all those individuals. I don't know for sure if all of them were able to reconvene at 1 o'clock, Mr. Chairman, but I think we should just go through this in order. And hopefully Dr. Moreno is on the line and can talk about the testing update at this point.
Dr. Moreno, are you available?
Yes, I'm here.
Thank you.
Good afternoon. So I understand that I'll be asking for the slides to be advanced. So afternoon, Ed Moreno, Health Officer and Director of Public Health, and I'm going to be providing an update on the on testing, but also modeling for our county, and then hopefully we'll provide some comments on how that any similarities or differences with the other modeling that's going on. So next slide, please. All right, so our current status of cases is again posted on our website. We update it every day. And as of the 12th, we have 87 laboratory confirmed cases. And that includes 20 hospitalizations and 3 deaths, unfortunately. We are receiving demographic information from the labs and the providers. And I can tell you that 43% of confirmed cases have no known pre-existing medical conditions that would otherwise predispose them to risk of severe disease. I think it's important for people to know because we are trying to protect the vulnerable population, but there's still quite a few people who wouldn't be considered vulnerable population who are still coming down with the disease. And our disease investigation team here in the health department have contacted about 550 individuals who've been exposed and have been and they've been ordered to home quarantine. Next slide. This is an epidemiology curve that Christy Michi has. She updates every day. It's also available, and it shows that for several weeks now, for a few weeks now, we've been able to, due to social distancing and shelter-in-place order, we've been able to limit the number of new cases that we see to anywhere from 0 a day to the max I think we had was 7 a day there in the middle of the graph. And so this is one indicator that the social distancing and the shelter-in-place order has been able to not stop the spread of the virus, but at least slow down the spread of the virus. So this graph is a reminder of all the good work that our businesses are doing, our schools have done, and our individuals and families in the community have done to try to slow down the spread of the disease. Next slide. So I want to talk a little bit about testing modalities. There's different tests that are available. Currently, our public health labs using the CDC validated test, which is a reverse transcriptase polymerase chain reaction, or PCR test. And that's a test where we can get, when we receive the specimen, we can usually get a result back to the provider that ordered the test within a day. We also have available now in, what's available is a gene expert nucleic amplification assay test, has some similarities to PCR tests. Some of our hospitals have it, but what they're missing are the cartridges to actually run the test. So if they receive if they collect a specimen, they can't yet run it in their labs because they may not have the cartridges that you need to run the test. But we do have the several hospitals that have the Abbott ID Now test, and that's one of the machines that was sent from California Department of Public Health to Salinas Valley Medical. And we also, this week, were able to send to them the cartridges or the reagents they need to run up to run tests on up to 96 individuals. So that's one good news I can share that in the area of expanding testing capability in Monterey County. Next slide. Serologic testing. So this is where we're not actually testing for the virus itself, like the previous test I was mentioning. This is where we're testing a person's blood and looking for antibodies. Antibodies are the body's response to an infection when the body is fighting off the infection. At this time, there's one CLIA, that's a national standard. CLIA approves serology tests in the United States. In the future, it may be helpful in determining the burden of disease on our communities and can give us an idea of how well social distancing is working. Next slide. However, it cannot tell us if a person is currently infectious. And also it takes time, because it takes time after the initial exposure to generate antibodies, the patient may be sick, but may have had COVID-19, but still hasn't generated enough antibodies for us to detect. So that would be considered a false negative, meaning it's negative, but the person actually had COVID-19. So there are some limits to serologic testing. The other limits to particularly tests that are not FDA approved are that these other serology tests might be able to pick up antibody, but it can't tell whether it's antibody from COVID-19 or it's antibody to a coronavirus that the person had at some point in their lives. So they can't distinguish the difference. Next slide, please. In our public health lab, we are able to test up to 80 tests per day, and we're available to test 7 days a week. And again, we usually get the results back to the provider within 24 hours. We actually received additional supplies to run more tests, so we're very happy for that. However, as we anticipate we're going to have outbreaks in congregate living facilities, such as skilled nursing facilities, and in order to do an adequate case and contact investigation to isolate people who are sick, quarantine those who are exposed, and separate those that weren't exposed, it can use up quite a few of our tests. So we're still looking, in anticipation of those events happening, we're looking for other sources of the reagents and test kits. Next slide. I want to express my appreciation to all the labs in Monterey County who are working together. We have some laboratories, such as I believe SVMH, who's actually figured out a way to generate their own supply of the test tube, the fluid that goes in the test tubes to transport the swabs. And so these supplies that are being generated here within our county are being shared so that we can all continue to swab and submit for testing. We've also received a large amount of swabs to our laboratory, and so we're in the process of getting some of those swabs out to the hospitals. So every hospital has the right amount of swabs and tubes with the media in order to continue to test residents of Monterey County. And as a reminder, there are other private commercial labs who are also receiving tests from our specimens from our hospitals. Their turnaround time, meaning the time it takes to swab the patient and send it in and wait for a result to be reported back to the provider, is anywhere from 6 to 14 days. Next slide. And this is, excuse me, a chart of testing that's going on. You can see that most of the testing in Monterey County is being done by our public health laboratory here at the health department. And there are other laboratories that are also receiving swabs, excuse me, and sending the health department the results of those tests. Next slide. So there are some barriers to testing. We would like to have more testing in Monterey County so that we can have more data to use to generate better estimates of the prevalence of COVID-19 in Monterey County. Those barriers include limited testing reagents and cartridges, but I gave an example of how we're locally trying to address that issue. Swabs and viral transport media, to be specific. And we also, there are limits to the number of microbiologists who know how to extract the DNA from the specimen and manipulate the nucleic acid to generate results. There are still a shortage of personal protective equipment, though County Monterey has been able to supply PPE to many of our providers. We still have a relative shortage of PPE. And we also, there are only a few healthcare facilities in Monterey County who are trained and are willing to collect specimens for us to test. Next slide. So I was also asked to provide some information on statistical modeling. Statistical modeling allows us to estimate the benefits, to estimate what the impact of COVID-19 would be if there was no shelter-in-place order and if there were no social distancing strategies being implemented, and what are the benefits of social distancing in reducing the burden on healthcare systems. Once we have an idea of what the benefits are, we can look at what the impact of COVID-19 would be after we implement all these strategies, and then compare that to what our capacity is in our hospitals to respond to a surge in need for hospital beds. And so it's primarily used for those planning processes. Next slide. There are some limitations to the model. First, I want to say that the models were developed for areas of the country with large populations, and they're already seeing a high burden of disease. These models, when applied to smaller numbers of cases like Monterey County, the information may not be as reliable, but it can still be used for planning purposes. The estimates vary greatly. If we change a few numbers early on in the course of the pandemic, it can have drastic changes, as you'll see later on. And as the epidemic continues and we have more data, the models can become a little more reliable. No model can accurately predict exactly what's going to happen in a complex situation like COVID-19, where we've implemented a lot of social distancing and strategies. And the other thing I want to mention is that there are a variety of models out there. Counties are using one or more models, and the state of California is using, I think, a Johns Hopkins model, which is different than the models that we've been looking at. The other thing is we may see differences as you're listening to the news, watching the news, listening to reports coming out of the state of California and other states. You may notice that results of modeling may appear different from Monterey County and from other counties. And that's because, partly because the state as a whole is at one place in the pandemic, but counties within the state of California are at different phases of the pandemic. So that's why it's expected to see some differences in the modeling outcomes between counties and between Monterey County, California, and between California and other states. So next slide. So we looked at the models out of Stanford University, University of Washington, and the University of Pennsylvania. Next slide. We used the University of Pennsylvania model. To use these models, we have to put in a certain amount of information. So we populated the model with our county population, with the timing of implementation, and the amount of compliance with social distancing. We also, we put in the rate of doubling that we saw at the beginning of the epidemic here in Monterey County. And we also input the percent of cases that are hospitalized and the number that are currently hospitalized. And finally, we add into the model the percent of cases that required critical care and mechanical ventilation. So this is, the inputs are dependent on data on individuals that are sick and confirmed and sick and requiring hospital care in Monterey County. Next slide. The results that come out of the modeling are described in terms of what type of, how many people will be infected and what type of level of care and resources we would need. So What we have here is the graph shows the projected number of county residents that would be infected at the peak of the epidemic. And so on the left, you see the number of individuals. On the horizontal side of the graph, you see the dates. It starts to the left, March 4th, and it goes out as far as September 4th. The first graph is area under the curve is blue. And that is the scenario the model says we would have experienced after we saw our first case if there was no social distancing and no shelter in place. This shows that at the peak, right around this week, last week would have seen up to 231,000 Monterey County residents infected with the virus. With 50% compliance with the health officer order, the orange graph shows that about 113 before the end of April would have been infected. With 60% compliance, that number comes down to about 75,000, and the peak is a little later. It's about first week of May. And then finally, the final version that we ran is if 70% of Monterey County residents and businesses complied with the order, we would have at the peak 33,000 residents sick at the same time. Next slide. And I can take a break after I show the graphs if someone has questions, but I still have more to present. This is the projected peak hospital census. How many people are going to need hospital care? Again, if we did nothing for social distancing, we would have had about a week ago over 9,000 people at the same time requiring hospitalization. With 50% compliance, that number comes down to over 3,000. With 60% compliance, 2,000. And with 70% compliance, it comes down to 900. So we look at that peak of 900, and we have a dotted green line going across the bottom of the chart that shows how many licensed beds our hospitals are reporting to the state of California that they have. And if the hospitals haven't done anything to prepare for a surge, the model suggests that there would be more people needing hospital beds than we have hospital beds. Based on information that's submitted to the state about our hospital surge potential, you can see the surge potential as of the last report was 954 patients could receive hospital care. And that is about right around the same estimated number of people that will need hospital care according to this model, as long as we have good compliance with social distancing. And then one more slide. Two more slides, I apologize. This one shows next slide. Oh, back, sorry, critical care. Oh, we need critical care, yeah. So what we don't have right now is what we have in this chart shows the number of critical care beds. And again, if we jump to the 70% compliance, we can see that the model shows that we would need 235 ICU level beds, and the hospitals, from what the most recent report, what I have is critical beds right now are 33. So we're still reviewing the reports from the state, and we'll continue to update this. So this is a chart that we need to update when I can have time to analyze the surge capacity. And one more slide. This one just says how many ventilators do we need. Doesn't say how many people are going to be ventilated, just says how many ventilators we would need. And according to this, our ventilators on site, as reported to the state, are 158 on the last report. And the model shows that if we're 70% compliant with social distancing, then the number of ventilators we would need could exceed the number of ventilators that we have on site. And I know the county EOC and the MOOC, Medical Health Operations Area Coordinator, and our hospitals are all working to make sure that all the ventilators that we do have are working. If any ones that need to be refurbished are being refurbished, and making resource requests as well. So why don't let's see what the next slide is, please. Yeah, so you can go back to the previous slide. Before I move on, I have more to discuss in terms of, I still want to get to the discussions about easing up on the health officer order for shelter in place. But any questions at this time, supervisors?
Are there any supervisors with questions at this point? Okay, please continue.
Thank you. So I just want to point out that with the next slide, that it's really, go ahead, next slide, that social distancing is really important, as you can see. So again, based on our modeling, if we had no mitigation, which was those tall peaks that we saw on the graphs, the number of cases would double every 2 days, which is exactly what we saw when we first started having cases here in Monterey County. Every 2 days, the number of cases in Monterey County were doubling. And one person infected can spread it to 5 other people. And the daily growth rate would have been 41%. So next slide. So after the shelter in place, we noticed that the doubling rate declined. And it suggested that around 50% of reduction in social contacts after the onset of the epidemic. We were seeing at 50%, we see a doubling time of every 4.8 days, or about 5 days. So every 5 days, the number of cases would double, which is much better than doubling every 2 days. And instead of infecting over 5 people, each person would only infect up to about 2.5 people on average. And that really slows down the growth rate. So we did see the doubling rate extended after the shelter-in-place order went into place. So again, I want to thank everybody for all your efforts in our community for your success in slowing down the spread of disease. Next slide. Let's see. I want to comment a little bit about more about hospital care and surge capacity. I want to let the public know that the hospitals and the county have been planning for a surge for several years. And in particular, there was a lot of planning that began in January of this year, specifically for the COVID-19. And our hospitals leadership are meeting with a county once or twice a week. We've been doing that now for several weeks, and have invited other partners into those discussions to talk about how hospitals in the county can work together on testing, on isolation, on containment of COVID-19, and working within our community to slow the spread of the disease. And our hospitals have, representatives from several of our hospitals have gone into the community and provided outreach. So there's been presentations to doctor groups, presentations to the community on COVID-19, what the impacts could be if we don't social distance, and what the benefits are of social distancing. And we also are getting more participation from our hospitals with Emergency Operations Center to provide technical advice on alternative care sites, because alternative care sites are considered an extension of hospital care. And we really need experts in hospital care to be participating in those discussions. Next slide. Also want to remind the community that there are ongoing containment measures. These are measures to specifically slow the spread of the virus through public health efforts. So the main one is adherence to the health officer order to shelter in place, which reduces transmission of the virus. That's very important. But we also need to, and we continue to have healthcare providers submitting samples and laboratories reporting cases of COVID-19 to us. We now have a case definition for suspect and probable cases nationally now that we can use to help us add to the data of people that may not have been tested for COVID-19, but maybe were exposed and have symptoms of COVID-19. That helps give us an idea of how many people out there have COVID-19 in Monterey County, given our limited testing ability. And we continue to investigate diagnosed cases and all of their contacts. Next slide. We also are isolating people who are infectious and putting people who were exposed into quarantine to prevent further spread. I appreciate very much our public health laboratory and the quick turnaround time, which helps with infection control decisions in our hospitals, in our skilled nursing facilities, and other congregate living facilities. And we really do, again, appreciate everything that our hospitals have done to implement very effective respiratory screening procedures at our hospitals and also in our outpatient facilities, which remove people who might have COVID-19 out of the rest of the group of patients seeking care so that it minimizes spread to other healthcare workers and other patients. And it also conserves on our PPE in our hospitals and healthcare settings. So much appreciation to our hospitals for that. Next slide. Our case investigation, as so far, we've been able to get in touch with every person diagnosed with COVID-19 in Monterey County. We've been interview all those cases and identify most of the individuals who the case had contact with. And we get in contact with each person who was exposed. And we also are getting in contact with employers as necessary to identify others that might have been exposed and work with employers to identify their employees or their clients and customers that might have been exposed. Ideally, we would want to test all contacts for COVID-19, but again, we do have limitations on our testing resources at this time. Next slide. We have been able to isolate ill individuals with COVID-19 and conduct case investigations. We've been able to quarantine people through their incubation period. And I just want, if we were to, I mentioned that we would like to test more people in our contact investigations, but again, that we would go through a lot of PPE and we would go quickly through our supplies for testing. So we haven't been able to do that at this time. Next slide. So this is the last portion of my presentation. I'd like to provide some information about discussions that are going on right now in terms of how we would plan to begin to ease up on some of the restrictions from social shelter in place and home social distancing. So as I mentioned, and as the data show, we've had some evidence that our community's efforts to social distance has helped, as people say, bend the curve or flatten the curve and avoid large hospital surges. So I'm very grateful for that. And I'm sure everyone that hasn't gotten sick with COVID is also grateful for that as well. But we do recognize that social distancing has a impact by disrupting our social, emotional, and it causes economic disruption. So we know that, and because of that, and how long this epidemic could possibly last, it's not. Many of us in public health believe it's not feasible to continue this level of restriction throughout the pandemic. So we're starting to have discussions on how we might start to release some of the restrictions in California. Next slide. We're looking at criteria that could be modified to provide less restrictive restrictions on certain populations. So it really requires us to have a balance between the social and economic benefits of modified orders and the impact of COVID-19 on vulnerable populations that haven't been infected and the impact on the healthcare system. So at this point, I just want to point out that as we look towards the timing of and the degree to which we modify health officer orders to be less restrictive, here in California, we still are, our goals are still to protect the vulnerable population. And we're also, our goal is to protect the healthcare system from a surge. So one of the things that we're looking at is some criteria. So just to give you just some examples of areas that we here in California might be looking at would be consideration of California's ability and Monterey County's ability to protect vulnerable populations. So as more people become exposed over time, which may happen with a less restrictive shelter-in-place order, there is a risk, unless we take decisive action, of exposing young people or other people getting sick with it, exposing our older population or people with underlying medical conditions. So we really need to continue to keep that under consideration. We could also consider the ability of public health to do case investigations, contact investigations, and continue to isolate and quarantine people who are sick and exposed. That's still probably going to be a very important part of any moving forward, excuse me. We also are very interested in assessing the ability of our healthcare system, in particular our hospitals, to handle the surge. By postponing, by pushing the peak of our epidemic out, further out into the future, it has provided Monterey County in California opportunities, well, provided us time, which provides us opportunities to continue to plan and implement our plans for surge, how we respond to surge, and also provides California and our nation to come up with solutions for helping us restock at this point, the amount of PPE and other resources we need. So when the surge hits, we will be in a better situation than if the surge was hitting us right now. So that's also a criteria that we need to consider. And then there are others, but these are the ones I really want to highlight today, so you have an idea of what are some of the considerations. The last one would be that just as essential businesses right now who are still operating are practicing and implementing social distancing, when we get to a point where we can have less restrictive, fewer restrictions, any businesses, any activities, any services that are allowed to resume need to have in place effective means of continuing to for social distancing. It won't be business as usual. It'll be a few more activities, a few more services that are allowed, but they have to adhere to social distancing. Otherwise, the concern is that the surge that we were trying to avoid would happen anyway, and we don't want to get in that situation. So next slide. So this is my last slide, just in summary. The models I mentioned are tools. They're tools to assist us with planning. They have to be interpreted and utilized carefully. The models may overestimate the scale, but they do reflect local effects of social distancing, so that's one of the benefits. And there are other counties and the state also using different models, so we can see different dates of the peak, estimated peak. And counties are different places in their pandemic in a large state like California. Second key message is that social distancing measures implemented early in the pandemic, such as we did in Monterey County, have reduced the rate of spread of COVID-19. Also, the stricter measures could help prevent the local healthcare system from being overwhelmed, but we have to, at this point, we're trying to balance the social economic benefits of at some point easing up on measures with trying to prevent a surge from happening. And finally, we do have planning efforts underway, as I mentioned, for future surges, still trying to ramp up our supplies and our resources, but we're planning for the recovery phase of the pandemic. So last slide. That's the end of my presentation. I'll take questions unless you want to move to another presenter. I appreciate you giving me so much of your time this afternoon, supervisors. But the number there, the 755-4521, 8 a.m. to 5 p.m., that's where people should call if they have questions about public health questions about COVID-19, and just follow the prompts, and you can speak to someone or get helpful information about COVID-19 in Monterey County. So thank you, supervisors.
Thank you, Dr. Moretto. So before I open it up to the rest of the board, I had a couple quick questions I was hoping you could give me some short responses to. One is, how do we define a recovery? Is that something you have offhand?
So actually, I might have used the word recovery. Excuse me. Okay, so I might have used the word recovery. The recovery is more of a preparedness and disaster response term. Whenever there's a disaster, there's always a recovery phase, and so I was referring to it from that sense. From a public health perspective, for a pandemic, recovery might imply that we're going back to the way things were. A lot of us in public health don't think we're going to get back to the way things were for quite some time. I think we're going to be implementing social distancing or some versions of social distancing and modified services and activities and education for a while because we're still very early in this pandemic. So this is it's changing weekly. Our plans change. We're getting we're narrowing down our plans, but our plans still change as the circumstances change. So I couldn't define for you what a recovery looks like, but I can, from this presentation, hopefully give you an idea of where we think we're headed at this time.
Thank you, Dr. Mark. Can you also define recovery of a patient for us? When do you consider a person recovered from COVID-19 on our numbers that we put out daily?
Sure. So a recovery from COVID-19 reflects someone who was, for now, confirmed with COVID-19 through testing. And then as we check with this person every day, when they meet CDC, the Centers for Disease Control and Prevention criteria for for no longer being infectious, that's when we change their status to recovered.
And then can you clarify for us and the public, in terms of the number that you're predicting, obviously in the modeling, that's not going to be the number that shows up in your report. Can you clarify why that is?
Yeah, I'm sorry, in which report?
So in the report that comes out daily that gives the public the numbers of the latest amount of confirmed cases.
Uh-huh. So the first, I believe the first graph that I showed you was the total number of people who will be infected. What I'm showing on your public health website are the number of confirmed cases. So we have over 80 confirmed cases in Monterey County, but we have many more people out there who had mild symptoms that did not want to come in to be evaluated or tested, or maybe not so mild, but testing wasn't available, or a clinician decided not to test. So there are people who have no symptoms who are exposed to become infectious and still don't have symptoms. So we have a lot more than cases. So the chart shows the total number, not just the confirmed. The graph that I showed you. Excuse me.
Right. I just wanted to make sure that clarification was out there. Now I see Supervisor Parker has her hand up. Supervisor Parker, do you have comments or questions for Dr. Moreno?
Thank you, Mr. Chair. And your last question got to my main question. So the chart that shows how many cases we would see if we didn't have social distancing and then the different compliance rates, that is really helpful to see. And it also shows that how important the shelter in place is, and for us to continue for a bit of time still to really adhere to that. That number of 33,000 say, and that with the 70% compliance seems to indicate that our hospitals and healthcare system can probably handle the cases who need acute care. Just so people know, I mean, 33,000 is still a pretty big number, even though it's much lower than, over 200,000. Do you have an estimate? So I have two questions. Do you have an estimate of if things continue as they are going, how many total cases we might see, say, by the end of the summer or into the early fall? And then the second question is, if there are 33,000 cases out there, but not everyone is being tested, can you give us an idea of how those numbers are what the numbers will be in the daily report? Because I just have a feeling that even though we're doing everything right, the numbers are going to get bigger, and it's going to be nerve-wracking and kind of scary for people. So I guess I'm trying to get an idea of, if the numbers are going up and they're turning into some fairly significant numbers, is that still evidence that we're doing the right thing?
Thank you for the question. So as far as the slide, the total number of cases, I think maybe the second graph there that shows the number of the hospital census might be a little helpful. That shows that with good compliance with social distancing, we might at a peak have 900 hospitalized patients at a time. And that might be closer, for now, that might be closer to the number of confirmed cases we might expect. because as long as we continue to have some testing ability, all of those, and things continue the way they're going now, each of those hospitalized patients would have been tested on admission to the hospital. So if we had 900 hospitalized patients sometime in late May, we would have at least 900 confirmed cases each day at that time, or around each day at that time. So hopefully with good social distancing, we won't get to that number of people needing hospitalization when we reach our peak. But that's really, it depends on the number of cases that show up on our daily count, depends on our testing ability, which depends on our access to testing material. So does that help answer the question?
That does. And actually, we're seeing a slide, and I think the slide you were referring to is actually maybe the previous one to the one. There we are. Yeah, one. Hospital census. That is helpful. And then do you have a way of estimating the total number of cases in this phase that we might see in?
Yeah. So thank you for that. So there's a term that we use called the area under the curve. So on a given day, on this slide, on a given day with good compliance, we might have up to 900 people in the hospital, in all of our hospitals, 900 people. And if you look at the curve, if you go past the 900, that number would drop off. So the hospital census would start to drop off once we get past our peak. The term area under the curve talks about all that yellow area down there. And so it's basically adding up every day. You add up the total number of cases every day, and at the peak it's 900, and then you continue to add as time goes on. That's the sum of all the cases. It's a good question, and I should have looked into that. I don't have that number of total people that might have been or will have been infected when the pandemic reaches the end of this graph. I apologize for that.
Thank you. And some of them, because it's a 2 week or a week to 2 weeks, or sometimes even 3, depending on the person, or to actually have the disease, there's some duplication in the numbers under the curve, right? So anyway, it's mainly a note of curiosity, and I appreciate you pointing to that hospitalization number as kind of the number to watch for in the daily reports. Thank you. Great presentation.
Thank you. Supervisor Alejo, I see you have your hand raised. Questions or comments?
Yes, first of all, I think all of us, including our members of the public, this is a hard lesson on how critical public health is and how important it is under state law why each county has a health officer to be able to monitor these potential pandemics and outbreaks. But I did want to just make a comment that the chart that shows the public the prediction of the peak of infection, it's not necessarily those who get tested and are confirmed as positive, but that includes the projected of people who may be asymptomatic, not showing any symptoms, or pre-symptomatic before they show any symptoms. Is that correct, Dr. Moreno?
Yes, you're correct, Supervisor.
And a question that we get asked often as elected officials is, are we doing enough testing? And your presentation earlier on, some of the slides showed that we're ramping up testing, but there's still a backlog in trying to get some of the cartridges or the kits to be able to do more testing of the community. Because once we're able to test somebody and confirm them, then we're able to isolate them, quarantine them, and then they're able to protect them, better get the treatment they need, but also protect family members and relatives, friends that they may come into contact with. So when do you expect that additional ramping up to happen if we get additional cartridges or kits? I know that just in the last 2.5 weeks from March 29th, our testing numbers that are reported daily have gone up almost 250%. That's good, and that's reassuring to the public, but we still get asked, are we going to ramp up even more to test more people and make that more accessible to members of the public?
Right. So yes, very good. So yes, in my report, I did demonstrate that the recommendation in contact and case investigation is to test more people, but we just can't do that at this time because we don't have enough. So we are prioritizing who gets tested. in Monterey County, and it's usually individuals that are in the hospital so that they can isolate and not infect other patients and other staff. In terms of what's happening, what's being done to increase the supply of reagents, test kits, and equipment and staffing to do more testing. We don't have control over unfortunately, the supply of the machines that run the test or the reagents at this time. So we in our hospitals have orders in for equipment and for supplies and for the reagents. So we are dependent on that. There are a few things that are in our control. One is developing the media the liquid that goes in the tubes to transport the swabs. And one of our local hospitals did find a way to generate those, and we're sharing that. The other is staffing. And so we have a little control over that, and we were able to get some volunteers from another laboratory, and I believe from one of the laboratories from Moss Landing, to provide some volunteers to come in and assist us in some testing methodologies. So that's in our control. We've done what we can, but we really need our vendors and the CDC and our private industry to step up and get those reagents to us.
Thank you, Dr. Moreno. Last comment was just even you looking at these numbers, the charts that you put up, even at 70% compliance with your shelter-in-place order, the predicted 33,000 people being infected out of a county that's 434,000 people, that's almost 8% of the population. And that's with the significant level of compliance. So the numbers really give, I think, a visual about how critical it is to continue the compliance during while this order is in place, because it does save lives. It does keep people out of the hospital, keeps that hospital census lower. And I appreciate having those kind of visuals for the public better understand how critical compliance is for us to keep people safe and alive.
Yeah, I see Supervisor Adams has a question. If I could just comment real quick on it. I talked about the area under the curve. The area under the blue curve, the orange curve, the gray curve, and the yellow curve in some of these models is the same. The same number of people are going to get sick. The thing is, you don't want them all getting sick at the same time like the blue curve shows, because then people can't get the care they need. Which if you're going to have the same number of people get sick in these models, we want the yellow curve, which, as you mentioned, Supervisor, the 33,000 people at the peak, all infected at the same time, but at least they're not all getting sick at the same time, which allows the hospitals to be able to respond and provide the care that I or you or others may need. Thank you.
Thank you, Supervisor Adams. Supervisor, you're on mute if we can't hear you.
Jeez, and again, I was the most eloquent I've ever been. I have a few questions, and most of them do have to do with testing, but then a couple of other comments. I just watched the governor's press conference, who indicated that we will be able to start to shift back to more of a normal sense when we hit his 6 points, the primary one being testing, that we have to be able to do more testing and that we need to show that we're prepared to do more testing. But if we aren't able to get the reagent to do this or whatever else that's needed, I don't know how we're ever going to be able to make that happen. So a couple of questions. As far as testing goes, is it the same testing or the same reagents that are needed to determine if someone has the coronavirus, COVID-19 now, or if the person carried something similar to coronavirus, some other form of coronavirus in the past? Number one question. And number two, if in fact we find this group of people who had carried it in the past, are they immune to COVID?
Okay, thank you, Supervisor. So I think the first test you were referring to was the actually testing for the virus, which we do in our public health laboratory, and what our hospitals are starting to be able to do. So that's where you actually take the swab, put in the nose, take the specimen to the lab, and you run the test, and the machine is actually looking for the virus itself. And when you have a positive test, that means that person is shedding virus. The virus is in the person's nose, and if they sneeze and cough, it's spreading. So those people are positive, those are confirmed cases. And that's the preferred testing modality for determining who needs to be isolated. There is another type of test, which is serology, which I mentioned as well, and I think you're referring to. And that's taking a needle and drawing blood out of a person's vein and sending that blood sample to a laboratory. And we're not looking for the virus, we're looking for antibodies to the virus. And thank you for the slide. The antibodies, for at least, it seems that for at least one test the FDA approved may be specific for COVID-19, which means if a person is tested in the blood, they have antibodies in the blood. For that particular test, it may mean that that person was actually infected with COVID-19, they mounted an immune response to COVID-19, and they survived their COVID-19 infection, which means that they've already been infected. So that type of information, if that gets ramped up, and the CDC and the FDA both say that when this test is run in a CLIA certified or a high complexity lab, you can rely 80, 90% of the time, you can be sure that that person was infected, and that person, hopefully, if exposed again, will not get sick again. That type of information would be very helpful, because then we get an idea of what percentage of the population has already been infected. So I hope we get to that point. We just need the FDA and the CDC to do their jobs to make sure that when a test is approved and it's being ordered by clinicians, we can reasonably rely on the results.
Thank you very much for that. That's really helpful. And then the last question then, can you tell me what other kinds of diseases could be, people have said, well, when we were kids, we may have had something like this. So what example, like mononucleosis or I don't know, what kinds of things could have been part of this?
That's a very good question. So, Supervisor, the COVID-19, so we recall, now we're referring to as COVID-19, it started as a novel coronavirus, which means it's a new coronavirus. There are different strains of coronavirus circulating through all the time. We see a lot of it more in the winter during flu and cold season. So there are different strains of coronavirus. A lot of us, I'll speak for myself, a lot of people my age, when we were kids, we were getting sick all the time. In preschool, daycare, kindergarten, we were getting sick all the time. And a lot of those infections were from coronaviruses, but they weren't new coronaviruses. They were coronaviruses that are circulating year after year after year. So if I was tested right now to see if I have antibodies to coronavirus, I might test positive because of all those coronavirus infections I had as a kid. What we're dealing with now is a novel coronavirus, which is a new coronavirus that no one has seen before, which means no one had the opportunity to fight off this infection, which means they have no antibodies to it. So the challenge for our research institutions and the FDA is to identify a testing methodology that says, if you're antibody positive coronavirus, this test is specific for COVID-19, and it and if you're negative, it's because you don't have COVID-19. We don't want a test that's positive for COVID-19 and for all those other coronaviruses that we were infected with as a kid, because then that doesn't help us.
Thank you. Thanks very much.
Thank you. Supervisor Phillips, any questions?
No, I think everything I was thinking about asking has been covered by my esteemed colleagues. So I'm good.
Thank you. I see Supervisor Parker has her hand up again. Supervisor Parker.
Thank you. I know I'm double dipping, but I did just want to suggest, it's more in the way of a comment, that that we, I think the governor had a slideshow that he presented in his press conference, and I think it might be helpful to the public if we put that on our COVID-19 website, and a link to the live stream or whatever, the recording of it, so that people can easily access information about the thought process going into trying to think about lifting the restrictions when that time comes. We can see for us it's going to be a little bit of time. We're going to have to take a deep breath and continue doing the good work we've been doing. But I think it would be helpful for people to know and find that information easily.
Thank you, Supervisor. Dr. Moreno, on behalf of this board and on behalf of all the residents of Monterey County, thank you for the work you're doing. I know it's not easy, and we know that there's a lot of demands on you at this time, but thank you. I also wanted to give one other thanks before we move on that I didn't get to mention in my comments earlier, but when all this broke out, we did have an offer from the Monterey Wine Company for some PCR machines that they keep in King City. And so I want to thank them for stepping up. I know that they didn't quite match what we needed at the time, but I think that that's honorable that they stood up before anybody had even asked for help to say, we have machines that you may be able to use, and we're going to put them at your disposal. And also to Gallo and Scheid, who've gone beyond their typical mission and made ethanol hand sanitizer available to medical facilities in Monterey County and to first responders through the county purchasing and contracts department. I thought that was an appropriate place to thank them. But again, Dr. Moreno, any final words for us?
I think I've said what I want to say, and I appreciate all your questions. I do want to, I express my appreciation to our health department staff, but to the hospitals and other partnering agencies. I do want to let the board know that Christy Mishi, who's the Assistant Director of Public Health, was primarily responsible for putting all this wonderful slide presentation together. So I really appreciate all of her hard work.
Okay, thank you very much. Nick?
Thank you, Mr. Chairman. Now to move into the next phase of our presentations, we have two major planning efforts underway. One is a care and shelter plan through our EOC, and another one is the alternate medical care site planning that's being done through our EOC. So the first speaker will be Gary Millay, our our Emergency Services Manager on the care and shelter plan.
Gary, the floor is yours.
Good morning. I do have a PowerPoint if that could be put up. Okay, thank you, board members, and to the public. If you can go to the next slide, you'll see the agenda. What I would like to talk about today is the Emergency Operations Center operations, and specifically the Care and Shelter branch and the planning that's been done specifically for the situation dealing with COVID-19, our response strategy, and then I will talk about specific sites that we're using to implement that strategy. Next slide, please. The Emergency Operations Center is a function of the Incident Command System. It has several sections, branches, and units that are the span of control that we use in the county to organize and assign tasks to manage the emergency response. The four sections that report directly to me as the EOC manager are the finance section, which is responsible for tracking all of our costs, and it is also responsible for tracking all of our recovery efforts and documenting all the things necessary to recover from the federal government, in this case FEMA, since this is a federally declared disaster. Our plan section, which is the organizing arm of the EOC and develops the operational tempo and handles all of our briefings and documents that are published that the public gets to look at each day. Our operations section, which is the largest section, they are the ones that are out in the field and are implementing the plans that are created. We have four functional branches under the operations section. We have a health branch, we have a law enforcement branch, we have an alternate care site branch, and we have a care and shelter branch. And the care and shelter branch is what I would like to talk about next. Next slide, please. Fortunately, the board approved a care and shelter plan in the EOC in 2018. And that was not a recent thing that we all of a sudden needed to do because of COVID. We had this planned and the board approved it, and we are implementing it for this disaster. This care and shelter plan will be modified specifically for COVID, and after the incident is over, it will be reevaluated to see if there's any changes that need to be met. Next slide, please. Now, we're really facing two critical challenges in the EOC. The first challenge is to help to isolate COVID-19 positive patients that live in congregate settings that would easily infect a large population of people if they're not separated. The second challenge is to assist our medical community, specifically our hospitals, with an overflow surge capacity, and that is done by developing what we call an alternate care site. Speaking to challenge one, next slide, please. We are developing alternate housing sites. Now, working with the hospitals and the health department, and really all of our jurisdictions, we are identifying people that have no place to go except back to their congregate living situation if they had a positive test to COVID-19, and we are separating them from that situation so that they can, number one, be isolated and recover more quickly, but more importantly, not infect the other population that they would be communing with at the time if they just went back to their normal situation. That is a multi-tiered plan that includes locations in several parts of the county. We are going to be implementing the Monterey County Fairgrounds as an alternate housing site. We're going to be implementing San Lorenzo Park as an alternate housing site, and we are going to be implementing the Marina Airport as an alternate housing site. We are also looking for an alternate housing site that we are in current negotiations with near the central area of Salinas that I don't have the exact location to report right at the moment. These sites will provide a place for people to be fed, have medical care if they need it, provide security, all of the services that they would need for daily life, as well as social separation within those facilities, so that we can then return them to their normal mode of housing once they recover and the health department clears them. So next slide, please. So I mentioned the sites already. Those are now public information. We are in the deep throes of that planning effort. And as soon as there are patients available, we can begin to implement these sites as an alternate housing site. With that, I know that was very brief, but I'm going to open it up for if there's any questions.
Any questions from board members at this juncture?
I have one, Mr. Chair.
Go ahead, Supervisor Phillips.
How does this dovetail with the trailers that are coming in from the state? And another question on the trailers is, if there's two people infected, say from the same family that can't go back to living situation, could we have more than one person in the trailer?
Yeah, Supervisor Phillips, there's a lot of reverb going on in the thing. I'll try to answer that question. I'm not sure why we're getting the vibration on the tone, but we are receiving 100 trailers that the state of California is purchasing for us. They are brand new travel trailers, basically recreational vehicles. They sleep up to 8 people. So they're very plush as far as the interior design and comfort for the person using them. And yes, they can be used for multiple people. So at the present time, our alternate housing sites at the Marina Airport and San Lorenzo Park will utilize those brand new trailers.
Mr. Chair?
Yes, Supervisor Alejo.
Quick question, just on, I know there's additional sites near facilities that are under consideration. Just in terms of time frame, when might those sites be rebuilt?
Supervisor, if you're specifically speaking to the possible site near the Salinas area, we're hoping to have our negotiations completed sometime this week.
Thank you, sir.
Supervisor Parker, I see your hand is raised.
Thank you, Mr. Chair. Yes, I just wanted to ask whether the people living in congregate situations include people who may be homeless at this time.
Supervisor, yes. All people in the county that have no other option but to live in a congregate setting, whether it's homelessness or agricultural workers that are grouped together in motels, any situation that we can separate people from infecting a large group of people that they would normally be living with, will attempt to be isolated.
Thank you.
Any other questions from board members at this point? Then we'll give it back to you, Gary.
Thank you, sir. I'm done with my report.
Thank you. Nick?
Yes, thank you, Mr. Chairman. If Dr. Walls is available, and also Dan Coughlin from Joby Aviation, I thought it might be good to have Dr. Walls talk first about the general concept of an alternate medical care facility, and then ask Mr. Coughlin to talk a little about the Joby Aviation property.
Dr. Walls, are you available?
Yes, sir. I'll be very brief. I'd like most of the time to go to Dan Coughlin. He's got a much more interesting presentation for us. So you've already heard basically what I was going to say. An alternate care site is a location off the campus of any of our 4 hospitals. It would be set up basically as an overflow for patients who are ill enough to require hospitalization, but not so ill that they require intensive care level services like a ventilator. Makes a lot of sense to keep all the ventilators at the hospitals where the ICUs are, where the pulmonologists are, where the ICU nursing staff is, and to surge up that capacity within the walls of the hospital. Once the hospitals are reaching their surge capacity, we need another location, and that would be the ACS, the alternate care site. This is a government authorized location that would provide basic hospital services, oxygen, nursing care, checking glucose, wound care, monitoring, checking vital signs, essentially. And we have searched high and low all around the county, looking at various sites before we had the opportunity to meet Dan and Joby Aviation, which I did not know about, but just an incredible organization, and very excited to be working with them. And I'd just like to give the rest of my time to Dan.
Mr. Coughlin.
Thank you, Dr. Walls.
There should be some slides for Dan.
Dan, you're back on mute. There you go.
That should be good. There we go. There. Thank you, Dr. Walls. First of all, we appreciate the opportunity to present today. My name is Dan Coughlin. I'm head of special projects for Joby Aviation. I work critical path items for the senior management, or critical items for senior management, one of which was a large fabric tent structure that we were in the process of constructing for our manufacturing capability here in Marina. I have just 8 slides today. I plan on giving just 2 quick slides, background on Joby itself, and then I'll transition into to the facility. I apologize in advance for noise. I'm actually at the construction site now, and if you'll bear with me at the end, I'll even give you a preview of the site as it's being built. Next chart, please. So Joby, you can press return a few times if you don't mind. This will bring up some bullets on the right. So Joby Aviation, we're currently based out of Santa Cruz, California. We are in the development stage of an aircraft, a unique aircraft called an eVTOL. It's an electric vertical takeoff and landing vehicle. What you see there is our latest build of the vehicle. We're currently in flight test of this vehicle. And so the idea is it takes off vertically. It's all electric. Takes off vertically, transitions to horizontal flight, and then lands vertically. Our intent is we're working arm in arm with the FAA on certification of this aircraft to both operate it and to mass produce it. We'll be doing that in Marina, and then operate it as an air taxi service. So imagine taking off from San Jose and reaching San Francisco in 14 minutes and avoid the congestion. It's our goal to save 1 billion people an hour a day, and that is the company's mantra. It's fast, it's economical, and it's super quiet. If you're near it, it's no louder than an air conditioner. And as it passes overhead, it's below, the noise level is below city noise. Next chart. Just a quick vector of where we are based. So currently our headquarters is in Santa Cruz, and that's where we're doing most of our development activity. We have a large facility in San Carlos that's responsible for both our power plant and our batteries. And then we are expanding into Marina to set up for what will be mass production of the vehicle itself. Next chart. So again, really quickly going through this is a overhead of the Marina Airport. On the top left, so we currently lease 3 large hangars at what was the former Fort Ord Army Air Base. We're refurbing these hangars to set up what we're calling our prototype production line, so that we'll be producing over a dozen aircraft per year in these 4 facilities. So on the top left, there's a composite fabrication shop that we're setting up. I'm currently sitting in building 507, which is going to be our additive manufacturing or our 3D printing facility. And then we've just recently signed a lease for building 524, which will be our flight operations center. What you see in the middle of the screen is a large fabric structure or a tent that's currently under construction, and that will be basically our integration and assembly area. So all the parts will be built in the 3 hangars and then brought to the tent. So basically in one side goes all the components, and out the other comes a full vehicle. It's 55,000 square feet. It's really large. There's 4 major sections in there, which might be of benefit as an alternate care site. It's behind secure fencing. There's a very large tarmac to the east of the tent for your support trailers. My understanding from Dr. Walls is there'll be shower trailers and laundry trailers and food trailers, that sort of thing. And both Marina and Joby are happy to host those on the tarmac to the right. You have air access, obviously. There's access from Reservation and Blanco Road directly to this site. Next slide, please. Just a view of the future. So Marina Planning Commission just authorized what is the construction of a 580,000 square foot facility. This has no bearing on the alternate care site, but just FYI, we'll be breaking ground on that hopefully sometime this summer and or late summer, depending on the use of the tent facility. Next slide, please. This was the picture as of, a little background on Joby. So we have an operation in China. Our CEO is a visionary in many regards, one of which was he saw COVID coming because of our experience of our operation in China. Joby was raising the red flag very early and taking precautions early. And it occurred to us about a month ago that this tent, if needed, could serve as overflow for hospitalization. And we kind of, depending on the schedule of the build, had planned to offer it, which we did last Tuesday. We met a contingent from the county, including the EOC and a number of members of the various planning groups. On Saturday, the decision was made on Saturday. By Saturday evening, we had an entire team mobilized. We have probably 40 people on the tarmac right now working on this facility. Our deadline is 3 weeks, and we think we can get there. We've got a number of schedule risk items, but we've got backup plans for it, and things seem to be falling into place with the help of the county and the city. Next chart, please. This is a layout. So on the left-hand side is the south, on the right-hand side is the north. There's 4 major sections, and this is to accommodate the manufacturing, but the plan so bear with us, this is a working document I've passed on to the EOC group for their planning purposes. We will put on the south end wall, and we will put on the second northern wall, which has an insulated curtain door, a big 50-foot door. So the 3 major sections you see to the left will be operational first, and then that'll allow us then to finish out the north end, depending on the type of patients that are brought into the facility. There will be plenty of power. We are just trenched for water and sewer today, and we've got the opportunity to provide data to you if needed, although there's a service provider that I've mentioned to the EOC right nearby that can provide data. We'll have some level of fire protection. We're meeting with the fire marshal today. So it should be a functional facility. Turn over the keys to you in 3 weeks. Next chart. Next chart. You might want to keep clicking there. Thank you. Very good. Our goal is to provide an opportunity to you a facility in 3 weeks. We're working through one of our risk items right now is HVAC or heating. We've got a backup solution to that as well, but we'll be gathering more detailed requirements from your group over the next day or 2, and making sure that we accommodate. Press return a few more times. I apologize for this. Safety is our number 1 goal. The safety of our workers out there. We all wear PPE. We've got a safety officer on site most times, and we've got access control, and so that's our highest priority. I had a help needed section on here, and that is no longer valid. So 2 of our long lead items was power. That was PG&E. We're working with them. I just got a call during this call, so Gary, your letter this morning moved some folks at PG&E, and then the Marina Coast Water District usually has a lengthy approval process for both sewer and water, and I received a call from one of their senior engineers today saying that they will assist us in our goal to get this facility over to you in 3 weeks. That's it from my standpoint. From Joby, we're very honored to assist in this regard. If you have any questions, I'm here.
Thank you, Dan. Any questions or comments from board members for either Dan or Dr. Walls? I'm going to look at Joel. I see no hands up. Any board members have comments or questions at this juncture?
Just to say thank you.
You're welcome, James. Nice to see you again.
Can I ask a question, Nick? So, I want to thank, obviously, Joby for stepping forward.
Yes.
Is this going to be a lease, or is it something we're doing in a straight partnership? Do we know what the structure of that is yet?
Earlier today, you authorized the CAO to enter into necessary agreements. I think perhaps Mr. Gerard should speak to that. Oh, it hasn't happened yet. Okay.
Okay, perfect.
Well, and just a moment of the backstory on this, Mr. Chairman. Charles McKee, our CAO, has been having frequent discussions with city managers, and we had been scouring the county for a site large enough to create an alternate care facility, large enough to handle what the projected patient load could be. And through his discussions with Mr. Long, city manager of Marina, this site became available. And I have to say, Joby Aviation's willingness to jump into this with both feet, and also Dr. Walls and an individual named Mike Jorgensen from CSUMB, who's been instrumental in helping us visualize what we need. This has been a real team effort, so I'd really like to thank everyone for that. The next 2 presentations are going to be about PPE status in general. First one is Mike Durr, who's going to talk about the overall ordering and procurement process and supply, and then Dr. Gray is going to talk more specifically about the Natividad Medical Center. Thank you.
Good afternoon, Chair Lopez and honorable board members. Mike Durr, Contracts Purchasing Officer, but more recently in the last 5 to 6 weeks working as your logistics section chief for the Monterey County EOC. I'm going to give you a brief update of where we're at, but before I begin with the logistics update, I just want to take an opportunity to acknowledge the awesome teamwork and efforts by the logistics team, which is basically the county's contracts purchasing office division team, pulling double duties lately. Next slide, please. Thank you. So all the challenges that you've heard about this afternoon all have needs and resources, and that's our job in logistics, is get those resources needed in response to this incident. And just to give you a kind of idea of the systems that we're working in, there's 3 systems that we order resources through. One is the Monterey County Web EOC, one is the Cal OES Web EOC, and then the Monterey EMS request system. Next slide, please. So just some of the types of requests that we've been getting through the Mohawk, which is medical and personal protective equipment, PPEs. You see the extensive list there. I won't go through it and because of time. Also the Web EOC request, those are shelter facilities, alternative housing sites, care sites, all the wraparound services that go with those sites. Those are things that we're required to get as logistics, sanitation units, healthcare supplies, labor support, and then also requests for Cal OES support. Next slide, please. Just to give you an idea of the volume that we've been dealing with, number of requests processed as of 4/13, the Mohawk requests were upward now of 350 plus. The Web EOC requests we're now at above 60. Some of the agencies supported by the brief list, NMC, Salinas Valley Memorial, pretty much all the community health organizations, both police and fire agencies throughout Monterey County, CAL FIRE, County Rural Fire, and the list goes on and on. Next slide, please. So some of the locations that logistics is working on to set up for both alternative housing and alternative care sites. Those were explained earlier by Gary, so he's kind of stole my thunder. But we're working on identifying hotels and motels within Monterey County. The Monterey Fairgrounds, I'm pleased to announce that we have sent the final logistics plan to the CAL FIRE Marshal and the Fairgrounds this afternoon for their final review and sign off. Once we get that, we'll begin mobilizing the resources to stand up the fairgrounds. San Lorenzo Park is an easy one. It's a county-owned facility. Laguna Seca recreational area is the same. We are also looking at options in Salinas, and prior to this meeting today, we got phone calls back from City of Salinas with regards to the PAL building and also the Rodeo ground. So we're in negotiations and discussions with them right now. The alternate care sites, again, Marina has been talked about. We're in negotiations with that. Kmart is a facility that's a large 60,000 square foot facility that might work for a care site as well. We're in discussions there. We were looking at the former Ace hardware store in Salinas. That one is no longer viable because it has environmental issues in it. So we're taking that one off of the list. And then we're looking at other sites under review and consideration. Next slide, please. So some of the successes and challenges that we've been having, staffing of the logistics section and continuity of the staffing. We've had successes, but also challenges for the long haul. Community support through donations. We had Watsonville Coast Produce stood up, American Supply, Chinese Community Group, and E&J Gallo Winery, thanks to Supervisor Lopez. Watsonville Coast Produce made a large donation to support the child care providers that are taking care of our first responders' children. American Supply also did the same. And then the Chinese Community Group has been identifying resources for us for N95 masks and other necessary PPEs. And then E&J Gallo Winery has donated locally produced hand sanitizer We got one large shipment and we are expecting another shipment from them. We got a call yesterday. Some of the challenges that we're facing is identifying available resources for PPEs. As you can imagine, there are a lot of schemes going on out there, price gouging. So we're having to triple check all potential resources before ordering. And then identifying labor support for the long-term coverage and activation of the logistics branch. Next slide, please. Just to give a team high five, with the assistance of a lot of team members from the county health department, county IT, and contracts purchasing, we were able to stand up a fully functional online portal for the placement of resource requests from the Mohawk. Prior to this setup, it was a manual process which consumed a lot of time on both ends within the health department and contracts purchasing. So this has really streamlined and made life easy for us in the operation of logistics. Next slide. Questions if you have any.
Questions from board members? All right, looks like we have no hands up. Back to you, Nick. Dr. Gray?
Hi, good afternoon. Hi, good afternoon, Chair Lopez and Supervisors. This is Gary Gray, CEO at Natividad. Just want to give you a brief verbal report, provide an overview of our PPE practices at Natividad, and comment on our supply. The CDC has provided guidance to all hospitals on PPE use. They have a preferred, preferred level and then an acceptable alternative. Natividad has been following the preferred level, which includes use of an N95 or higher respirator, face shield or goggles, gloves, and an isolation gown. At Natividad, all of our practices around PPE are being governed by a multidisciplinary committee. This includes doctors, nurses, and leadership. We've provided healthcare providers and support staff with required education and training with any PPE ensemble that might be necessary for them to perform their jobs. Even this week, we're providing training 3 to 5 times a day. To preserve PPE, we implemented engineering and administrative control measures approximately 3 weeks ago. We reduced the number of patients going to the hospital in outpatient settings. We've excluded healthcare providers and other non-essential folks from patient care areas. We have reduced face-to-face providers between healthcare providers and patients through implementation of telehealth. And we've also been excluding visitors to patients with confirmed or suspected COVID-19 cases. And we're also cohorting our patients and our healthcare providers in our isolation ward. Specific to supply, critical supplies that folks would need would include isolation masks. We currently have a 30-day inventory based on our present usage. In N95 mask, based upon our present usage, we have 197 days on hand. The only element that's approximately 14 days are isolation gowns, though we have several contingency measures to fill in that void if our current order is not fulfilled. If our inventory does become low in any particular area, we will follow the CDC's contingency strategies. This may change daily standard practices, but will not impact the care delivered to our patients or the safety of our personnel. These practices would essentially be used for temporary shortages of a particular material. So in closing, I really want just to acknowledge our materials management staff and all our staff and the county for assisting us with our PPE supply. We really appreciate our bedside caregivers, and I'm happy to answer any questions that the board may have.
Thank you, Gary. Any questions from board members? All right, back to you, Nick. Thank you, Gary.
We can't hear Nick.
Hello? Are we on? How's that?
We hear you now.
Okay.
Yes.
All right. Thank you. The last group of presenters today are the small business, are going to speak to small business assistance. Kimberly Craig from the Monterey County Business Council, Lee Takakawa from Cal Coastal Rural Development Corporation, and Chris Donnelly from the Workforce Development Board. And perhaps we could take them in that order, Mr. Chairman, if they're all available. Thank you.
So we'll start with Ms. Kimberly Craig.
Good afternoon. Good afternoon. Oh, hang on one second. Let me make sure I can mute the reverberation. Can you still hear me okay? Yep.
Yes.
I just want to give an update on what we are doing with small business help here in Monterey County. The Monterey County Business Council early on recognized that we needed to form a partnership with the County of Monterey, the City of Salinas, and the Small Business Development Center. The SBA released 2 major disaster loan opportunities, the EIDL, which is the Economic Impact Disaster Loan, and the PPP, which is the Paycheck Protection Program. The Economic Impact Disaster Loan had up to a $10,000 advance. It was $1,000 per employee. And the Paycheck Protection Program covered payroll for employees for an 8-week period of time. We realized relatively quickly that there was a tremendous amount of confusion with small business owners. It was 800 pages of legislation, and it kept changing about every 12 hours. So we needed to provide succinct and accurate information to as many small business owners as possible. And so we launched, in collaboration with multiple groups, we launched a webinar series. The first webinar series was a tutorial on those options, so that it was a bullet pointed and very easy to digest opportunity for those business owners. We had 798 small business owners register for the webinar. 622 participated. And then last week, we realized that the Paycheck Protection Program still needed a little more information to go further into detail on it. So we had a webinar specifically on the Paycheck Protection Program. We had 345 business owners register for it, and 179 were watching at our peak time. We realized that independent contractors and self-employed people were really having difficulty finding a lender. A lot of small business, a lot of local banks were requiring that you had a previous banking relationship with them, business banking relationship. And so we were able to get the #1 SBA lender in the nation, the Fountainhead Commercial Capital. The CEO, Chris Hearn, was on the call last week, and he let all of those people know that they are accepting PPP applications from people they don't have a previous banking relationship with. So that was a huge win for local businesses who really couldn't find a lender. We also had Bill Tebby, the market president of Bank of America, on the call, and he was talking about big banks and not to worry about their asset cap. They certainly have the capacity to be able to manage and process all of those PPP applications. This upcoming week, I recognize Supervisor Alejo gave us a shout out at the beginning of the meeting. We have a disaster loan tutorial in Espanol, and you can find it on Eventbrite. It is the instructions and everything. The registration are all in Spanish. It's a relatively easy registration, and we are partnering with El Pájaro CDC. And we've also asked the Salinas United Business Association to push it out to their members, as well as the Monterey Chamber of Commerce and the Salinas Valley Chamber of Commerce. It's really important that we recognize there's about $5 million of retail sales tax that comes out of the ALISAL. And so we want to ensure that everybody has an equal opportunity in learning what those programs are that the feds are offering. Just a thank you again to Supervisor Alejo and Supervisor Phillips for promoting it on their social media channels. I think that really, and the county as well, we are growing our numbers in terms of who's tuning into those webinars. And also I should note that I've been in conversations with the City of Salinas and we're exploring iBank state disaster loan guarantees, which is a program that is geared to those who cannot qualify for federal programs. So perhaps some undocumented opportunities for business, opportunities for undocumented business owners in our community. So as we go forward, I just want to give a quick update on a couple of our key industries, the hospitality industry. We are involved in discussions with Monterey County Hospitality Association and in the city of Monterey. There's a real push to create a business plan for rolling out business once the regional reopening is announced. I think there's a huge motivation to get the hospitality industry back up and running. Additionally, we've been in discussion with the Farm Bureau. The ag industry continues to struggle. Some product is not being harvested. Some companies have really been struggling because they had contracts with like educational systems, and obviously with schools being closed, that means that they don't sell that product. Some are doing okay, those that have contracts with retail and food service. And the Farm Bureau is continuing to work with electeds. I know Supervisor Lopez and Supervisor Alejo have been working on ag worker protections as well. So just in closing, I want to acknowledge that we have really made an effort to give accurate information and speak with one voice. And so the Monterey Peninsula Chamber of Commerce, the Salinas Valley Chamber of Commerce, and there at the county, I just have to acknowledge Anastasia Wyatt and Debbie Bradshaw have been incredibly proactive and reached out very early on to assist us in getting the word out about what's available for those small business owners. So we are looking forward to the regional reopening plan for Governor Newsom, and certainly understand that community health is a #1 priority. But we also need to prioritize getting Monterey County residents back to work so that our economy can continue to thrive once again. Thank you.
Thank you, Kimberly. Any questions from board members on that presentation? Supervisor Phillips?
Yeah, I just wanted to thank Kimberly. We referred a number of people, a lot of calls we got in, and we referred a number of people to her and her organization, and they really helped out. I know Rancho Cielo got involved and got a loan approved with a lot of work on it going through, but got a loan approved to take care of their employees. So I appreciate all your hard work.
Thank you.
Thank you. Any other board members? Supervisor Parker.
Thank you, Mr. Chair. Thanks, Ms. Craig. Thank you for the all your work and for the presentation. You mentioned that some ag producers aren't able to place product because of the schools being closed. The schools are handing out food hand over fist. So I wonder, we've talked a little bit, but maybe if you can check into this too, to see if there are ways to funnel that fresh produce to food banks, which are really feeling the pinch. So thank you.
I'm happy to pass that along to the Farm Bureau and those that are working on it. Thank you, Supervisor Parker.
Just Supervisor
Alejo? Oh,
thank
sorry.
you.
I'm going to go. Yeah, Supervisor Alejo.
Sure. I had my hand raised, but I didn't want to just answer that because that question has come up, and and the Farm Bureau, the Grower Shippers Association, they've all made clear that they're assisting their members that when there is harvest that may not be picked or canceled, contracts are canceled, that they do try to encourage and facilitate those donations to the food banks. I wanted to make sure that all our local organizations have been on top of it, and their staff and trying to make those things happen in Monterey County. I did want to just point out that even though we're both at the local level and the state level, we're talking about how do we get back at some point to properly plan strategically and informed in a smart way to get our economy back going again. It's these kind of services, these emergency loans, this technical assistance that are going to keep these small businesses going through the hardest of times. Without income, without an ability to pay their rents and their leases and their bills, their utilities, many of these small businesses might not have the ability to come back after we try to get our normal lives going again. So it just reiterates how important this kind of assistance, sometimes a one-on-one help, guiding small business owners to be able to get the help needed to bridge this tough period of time. That's what's going to keep them going. We all recognize, the research shows that small businesses are our largest employers, and they're the soul of our different cities and our communities. So that's why these kind of services that Kimberly Craig just talked about are going to be so critical to get our economy back on a strong footing again in Monterey County. We were doing well. This came out of, like, none of us had ever experienced something like this, but a critical part of this is making sure our businesses are able to come back and rebound. Thank you.
Thank you, Supervisor. I'm going to go to Supervisor Adams.
Thank you. Kimberly, first off, thank you so much for this. You're really just doing such a terrific job. And I'll start by the last question I'm going to ask, which is, what can we do to help? So think about that while I ask you the other questions. Are people having difficulty, and do they need assistance in completing the paperwork that's required? And are you guys able to do that, or do you have a cadre of volunteers who are helping you ensure that that gets done?
So the direct answer is the supervisors can certainly help by passing out the information that we post each week on the webinar. That is really sort of how we can reach the masses, is, ensuring that we're providing, again, accurate information to as many people succinctly as possible. So if the supervisors wouldn't mind being able to help cross promote that, that's also a key component, is just making sure that we reach as many people as possible, which is, I'm all about handing shovels out in the sandbox. I want to make sure that we are being as proactive with chambers and with other membership-based organizations to ensure that we are all working together. Secondly, your second question, there is assistance to help fill out that paperwork. Monterey County Business Council does not do that specifically. We have helped a few, but the Small Business Development Center, which is right here in downtown Salinas, will actually help you fill out the paperwork. The EIDL takes about 10 minutes. It's online. The PPP is a little more involved, but it's through your lender. I would really recommend, if you want assistance in filling out that paperwork, to call and make an appointment. They are completely slammed. I think they had, if I'm not mistaken, they had 79 businesses last year that they assisted. And in the last 2 weeks, they've served 256 small businesses. So you can imagine their phones are ringing off the hook, but they remain committed to helping out those small businesses. As well as El Pájaro CDC, they are also willing to help Spanish-speaking business owners fill out that paperwork as well.
Great. And then would you know, in general, I'm just thinking you're doing such a terrific job, would you say 256 is about the number of people that you have helped, or is that just going through the Small Development Center? I think you should factor in the numbers of people who attended the webinar series as well. And just kudos again for all of those folks coming through a good project that you're doing. What do you think as far as the funding that will end up, how would you translate this into dollars? Whether either dollars saved or dollars invested? It's just so impressive.
Well, thank you, Supervisor. I would say we've, in the last couple of weeks, we've helped at least 1,500 small businesses between the two webinars and SBDC. I know Lee Takagawa certainly has been humming along over there at Cal Coastal. And, in terms of equating it to dollars, I don't know if I can actually put a dollar figure on it. We have a lot of people who work from home, who are self-employed. And then we have, large companies in our area. It's a really, really diverse mix. Recognizing that we have significant amount, I think the Census Bureau builder acknowledged 25,000 non-employer businesses in Monterey County and 8,754 employer-based businesses. So it's really just making sure that we reach as many people as possible.
Great. Keep up the great work. Thank you.
Kimberly, on my behalf, I just want to say thank you. I know we've participated on some calls together around the impact on businesses of COVID-19. And for me, I grew up in a small business family, and knowing that small business owners are doers. They're people who return calls immediately because they know that that's what their livelihood depends on. And they're the type of people who want to react as quickly as possible to give great service. And I know that there's been a lot of frustration out there beyond what you're doing is incredible, and I want to thank you for that. And then after they get through the application process, it's been a lot of silence. And I think that's the scary part for a lot of these people who so often are those that are reacting quickly to keep business and stay at the front edge of things. And when they've been asked to stay home, it's really a difficult ask of people like my dad, who we always joked growing up that it was the Shark Tank theory. He said if he stopped swimming, he would die. He had to get up every morning, go to work, raise the flag, turn on the pot of coffee, and it was his traditions. If he stops doing that, he doesn't know what to do with himself. And so I think there's some frustration in that community. I'm hearing it from within my own family about the lack of response from some of those bigger programs. But knowing that there's a local resource like you and somebody to help guide folks through this is so critical. So thank you for the work you're putting in every day to give that reassurance to local businesses. It really means a lot.
Thank you, Supervisor.
And now we're going to go to Lee Takikawa from the Cal Coastal Rural Development Corp.
I want to thank the Board of Supervisors for allowing me to speak today. I'm the president of California Coastal Rural Development Corporation, and we've been around since 1981 delivering farm loans and small business loans. But about a year and a half ago, we became the host of the Small Business Development Center. So as you know, we're up front and center on providing the businesses right now with the main thing, the primary thing that they need assistance with is the economic injury disaster loans and the Paycheck Protection Program through the SBA. So we're busy providing webinars and helping them with the applications. And once we started taking the volume that we saw, we knew it was evident that they needed more assistance than we figured on. And it was very hard to do one-on-one assistance. So we're doing that through the webinars, which have been well attended, and we're following up after the webinars with a lot of questions that are asked. I'm talking about hundreds of questions that need follow-up after we do those with Kimberly together jointly. So today I'm here to talk a little bit about our disaster programs. On April 2nd, the Governor Newsom, he announced some additional funding through the state, and it was $50 million in disaster relief loan guarantee money, which translates to $100 million because it's leveraged 2-to-1. Cal Coastal is one of 7 corporations in the state that deliver that contract with iBank to deliver that program. So right now we're preparing to do a huge number of loans to that program. And we're actually jumping in and helping our sister corporations down in Southern California that they're overwhelmed right now. And so we're stepping in to help them. And this is a program where if they're not eligible for the SBA programs, they can be eligible for the state loan guarantee program, but we do need a lender. So what's happened is iBank, typically we only had lenders that were banks and credit unions, regulated financial institutions. We've opened this up to what they call community financial development institutions. And they've received that designation from the Department of Treasury to become, they're really non-bank community lenders throughout the whole nation. But in California, we have a handful that are going to deliver some product here in our state. There's one very big CDFI called Axiom. They're going to be doing 1% loans, and then we're going to be helping them with loan guarantees. This is primarily for Southern California. The rest of California Opportunity Fund will be doing loans, and we'll be helping them with loan guarantees under this particular program. And then recently I was able to approve a local CDFI called California Farm Link, which is out of Aptos. And they're a nice CDFI ag lender, and they're going to be participating in the program so we can help some agricultural producers with disaster loans as well. So we're going to be very busy doing that. It can go to nonprofits, farms, or business with the state product. But what I'm here to talk to you about today is an amendment under our existing revolving loan fund with the county. And as Kimberly said, it was a partnership between Her organization, the City of Salinas, the County of Monterey, and the National Development Council. And we took the existing county revolving loan fund, and typically we were doing loans of up to $250,000 at 7 to 8%. We're looking at using $661,000 that's remaining in the fund to carve out and make emergency microloans out of that. They're going to be $25,000 and less. But what Cal Coastal really wants to do is reduce that interest rate and give deferment periods to get these businesses kick-started and not have to worry about loan payments. So we're going to structure these loans with up to 9-month deferrals. We're going to lend at 75% of prime rate, which today is 2.44%. And when we do the loan origination, we're going to fix the interest rate so that these businesses don't have to worry about interest rate changes. We're also going to set aside $200,000 of that money for South County businesses, and we're going to reserve that funding until the middle of May 15th or so. And this is something that county staff recommended, that we reserve some of the money for South County businesses. But if we don't get application and there's no demand down in South County, at the middle of May, we're going to open that up to first come, first serve for all the applications that may be. We think there's going to be a huge demand for this. So right now, Cal Coastal, I've received delegated approval authority to basically avoid going to loan committee and board of directors, which is our normal approval process. And I have approval to sign, me and my chief credit officer, we have the approval authority to sign loans of $25,000 or less in conjunction with one of the county staff that administer the fund. So we've streamlined the program. We've already approved 2 loans. One was in City of Salinas, the other was in Pacific Grove. Both of those were $25,000, and that's the maximum, but we do plan on seeing some smaller loan requests, although usually everyone wants the maximum loan amount when they apply. These are going to be for working capital loans to support their overhead, while many of them are closed and shuttered. So, just walking around, you could see the travesty where businesses are shuttered. And so we're trying to reopen them and give them some working capital. And I'll tell you what, I think we can deliver quicker and faster than some of these other government loans. The PPP and EIDL loans, they still, many haven't received funding, but we process these loans within days. So with one of the loans, the one in Salinas, we're preparing loan documents and getting ready to fund tomorrow. So that's how quickly we're working. We've developed some literature. We're going to be putting brochures on our website. They're going to be in Spanish and in English. We're going to disseminate that to the municipalities and the county, and we're going to try to deliver. We've been working really closely already with South County businesses and jurisdictions, so we're going to make sure that we do outreach down south. And we have Spanish-speaking staff. We have loan officers that speak Spanish and our SBDC as well. So we can help them with the applications, whether they're needing any kind of disaster loans. And then, as you know, Cal Coastal, we have all kinds of other loan programs that if they don't fit into the disaster loans, we could still provide financing in other ways. And we can do loans up to $5.5 million. So they're pretty sizable, but this was able to create a local tool for local businesses and be able to respond quickly. So what we're doing is I really appreciate the support from Chair Lopez on this issue, because the county had staff had gone to him to explain what we wanted to do, and that's why we're here today. So anyway, we are in the process. We are live with the program. What you can do is to help, if you have constituents in your districts, you would really just want to have them call Cal Coastal's main line, which is 831-424-1099. And that's our main line, or our Small Business Development Center, 831-676-2017-2017. And then our company website is www.calcoastal.org. On the website, you can direct them to fill out a pre-qualification. And if they're eligible, staff will contact them. And we also have a loan application on our website they can fill out. It's not a fillable form, but they can print it out and fill it out and scan and email it to us. So that's the best way to deliver services. We are not open to the public. I have my staff working remotely, so we can't take appointments, but with Zoom and Skype and everything else, we're able to still deliver. We're 110% functioning. So just want to open it up to see if you have any questions and if I can address any concerns.
Any questions from board members? Not seeing any hands go up. Lee, thank you so much for all that you've done for our small businesses here in Monterey County. We greatly appreciate it.
Thank you so much.
All right, Mr. Chulos.
And our last presenter today is Chris Donnelly, the Director of the Workforce Development Board.
And Supervisors, Chris Donnelly, Monterey County Workforce Development Board. I'm going to provide a little bit different update in regards to what we do for businesses. Part of our responsibility as Workforce Board is to be able to assist businesses that are downsizing or laying off. And part of this is that the Workforce Board receives the WARN notices. These are the Workers Adjustment and Retraining Notifications. And this is when a business is laying off 50 or more employees. And so we've been collecting data for that since March 17th. We've received 46 more notices, resulting in 6,818 layoffs. And then also we received 32 other notifications, resulting in 603 additional layoffs for about 7,422 impacted employees in Monterey County so far. We've also been reaching out to other businesses. We've conducted outreach to about 400 businesses in Monterey County. And this is to provide them information on our services to business owners and their employees. As a result, when we've contacted these businesses, 90% of the businesses are closed. And those businesses that we've contacted, there's about 10% of those businesses are looking at not reopening. We anticipated that those individuals that businesses we've called, about 1,100 additional layoffs from these are going to take place from those. And a little bit of where the WARN notices and the sectors are taking place. The largest sectors are hospitality, accommodations, and leisure, food services, healthcare, and social assistance. So we're seeing those layoffs. And the social assistance is primarily your hairdressers, your other areas that provide that type of assistance, health clubs, so forth. And the areas where we see the largest impact is Monterey Peninsula and Big Sur is 50%. 56% of the layoffs are taking place in that area. Salinas is 42%, and South County is 2%. So these are the areas that we see the largest impacts so far today. We're receiving more notices every day, and so what we're doing is compiling a weekly update of regards to all the WARN notices. Part of our responsibility when we go out and meet with the employer is usually that we meet with them, and we meet with the employees to talk about our services. Since we have with social distancing and closures, we are not able to meet with employees, but we provided that information to them, how to provide for unemployment insurance, where to go for other information, what they might need to assist them. There was also a study that was done by the Everhart School of Business with the University of Pacific, and they were looking at the total employment impacts for all of Northern California. And part of the study, what they did is they looked at the Monterey Bay Area, what included Santa Cruz and Monterey counties. And their studies, what they're looking at is the unemployment rate projections for Monterey County for May of 2020 is 19.4%, with looking at 39,240 people unemployed. And again, they're looking at the largest areas of unemployment would be taken in the food preparation and service industries with 15,000 or a 79% loss in jobs. And then personal care and sales around the top three. Giving a little bit of historical information about unemployment. In February 2020, our unemployment rate was 10% with 21,700. May of 2019, it was 6.2%, 10,943. In May of 2020, the Great Recession, it was 12.7%, with 23,000 people being laid off. And California projected unemployment rate for May, they're looking at 18.8%. And our new unemployment rates for March will be coming out this Friday. What are we doing as a workforce board? We've dedicated a page on our website for business and job seekers for COVID-19, added 2 toll-free numbers for easy access for businesses and job seekers to reach out to the workforce board, to our service providers to get any information that we need, that they need or are seeking for. Information on the website, we've really dedicated an area for how to apply for unemployment insurance, payroll protection program, links to SBDC, information on paid family leave, and our rapid response presentation, as I mentioned earlier. So, we are continuing to provide services to our clients. The Workforce Board enrolls approximately about 600 people a year in our programs that we provide them service to, and that is job training programs, assistance with workshops, online trainings, other parts of services that we can assist them in finding employment. Some of the things that we've been doing is that we still continue to provide conference calls with our clients. We're providing workshops via WebEx and Zoom. And we've also been able to streamline our enrollment process for people who are looking at coming into our centers for these services through e-signatures. So we've also developed a new job board for our website that we're listing jobs where we see immediate openings with the Monterey County for those people who have been impacted or looking for jobs, that they could be able to go to our website. We could be able to assist them with those job postings. And then also further actions by the Workforce Board, we've applied for 2 additional assistance grants from the Department of Labor, has a National Dislocated Worker Assistance Grant for $300,000. And this is basically for work experience and to be able for these individuals to work in humanitarian aid, to be able to provide services in soup kitchens or at the food banks or other areas that we feel that it might be necessary for them to be able to get this. And this is they'll be paid $17 an hour for about 30 hours a week for 6 months. And then we're looking at another grant from the state on additional assistance for about $120,000. And this is to provide additional supportive services to individuals who need additional support with emergency mortgage or rent payments, need supportive services for them to be able to continue with their trainings and so forth. So once we move into our new location on Salina Street, we're also looking at trying to dedicate an area that would be available for Business Assistance Center to be able to assist small businesses and have available resources for them as well. So that is the end of my presentation. If there's any questions that the board would like to ask.
Questions from board members? Seeing none, we'll take it back to you, Supervisor Adams.
Just one question. Chris, are you working in collaboration with other entities like the Small Business Development Group we just heard from?
Yes, with Cindy and I have been in contact, and we're trying to share resources back and forth with each other. So I've made available when we move to our new location that could be an area where she could be able to provide workshops into other services that she would like. But right now it's with SBDC.
Thank you.
All right, back to you, Mr. Chulos.
That concludes the presentations for this afternoon. I want to thank all of our presenters, and I think you can see that there's a tremendous amount of effort going into addressing the response to this emergency in the county.
Thank you.
Thank you.
Any additional comments or questions from board members?
Mr. Chair,
Yes.
I did want to just recognize all the hard work by our county staff. The public doesn't get an opportunity to see all the planning, site visits they do, all the conversations and phone calls between local and state officials to make these plans happening, to make them happen. But I did want to recognize and thank them for being heroes, planning for every possible scenario, even the worst case scenario. I think that's reassuring. I think that the public appreciates knowing that we're planning for all possible outcomes during this crisis. And hopefully some of those resources we don't have to use, but in case we're in a tougher situation, we're able to plan now rather than trying to respond last minute. And I think it's all with the best interests of the people of Monterey County in mind through this all. Thank you.
Thank you. Supervisor Phillips. Make sure you unmute, Supervisor.
Can you hear me now?
We got you now.
Yeah, sorry. No, I think this was helpful, and I think it was, we've been keeping apprised of this, most of this as we went along, and we have informational input 2 or 3 times a week, but I think it was important for the community to hear a lot of this. And I know we here in North County are going to put this on our outreach sources so that we can get it, especially to the small businesses that have been impacted, and hopefully can take advantage of some of the opportunities here. So I appreciate all that as Supervisor Layoffs said, it's a good thing for people to know how much our county and other affiliates are working with us to get some of the relief that we sincerely need. Thank you.
Thank you, Supervisor. Supervisor Parker.
Thank you, Mr. Chair. I also want to thank the staff and our community partners for the presentation today. I think really helpful information. And I also just want to thank our cities, businesses, nonprofits, and members of the public for all the generosity that we're seeing and just the high level of cooperation. I think we're in a really good spot in terms of slowing and controlling the transmission of the virus. And it's taken a lot of work on everyone's part. And I just want to thank the public for the compliance and the continued sacrifice that everyone is making to protect the health and well-being of people in our county. Thank you.
Supervisor Adams. You're on mute,
Thank
Supervisor.
You. I think I'm unmuted now. I too just want to appreciate express my appreciation for all of that the staff is doing. Sometimes I think that they are so behind the screen that the general public doesn't get a full idea or understanding of exactly what it is that they do. And I am just very thankful that we have them. One of the comments that the governor made today, as he was talking about all of the things that we're facing, is that there are also sort of opportunity nuggets that we can see as we move forward. We have some new opportunities as we look to reinvent ourselves after this whole situation dies down. And I think that so much of the new and creative thinking that comes from small business. So I'm very appreciative to see the effort that's being put forward to the small businesses that we have in our community. It's what makes up so much of our economic base. And I can only say thank you again to the creative minds that are coming through. I think it's really, it's an opportunity to think anew. And I'm seeing today just the new thinking that we're getting from our staff, as well as from the many creative people that we have in our business community. So thank you. It's hard, but we too shall survive.
Thank you, Supervisor. CAO McKee.
Thank you, Chair, and thank you, board members. I appreciate all those comments showing the recognition of county staff and others working on all issues surrounding COVID-19. This is a time where it's evident why government is important, because this is where government shines, and this is the purpose of government, to stepping in the time of crisis, because it's the only organization that can bring together all the necessary resources that might be available in the private sector and the public sector, bring them together in a coordinated effort to combat the disease, the virus, but also to marshal the help that's needed for our community. The comments that you've made are exactly on point with what I always see in our staff behind the scenes, all the great work that's happening. There's always a ton of great science going on at the health department that people don't see. It's happening on a daily basis, and now's the time for the public to become aware of everything that they're doing. And it's a really impressive, and it's why we need to support their efforts. I think a couple of years ago there was a a proposal to potentially eliminate the public health lab, and now we're seeing exactly why that was not a good idea. In this time is exactly why we need them and their expertise. The collaboration with the cities has been great. We've been working well with all of them. Of course, right now I really am appreciative of the city of Marina. City Manager Lane Long, their Mayor Bruce Delgado stepping forward to offer up the opportunities that might come with the Marina Airport. The airport is centrally located geographically for the needs of having an alternative care site if we get to that point of needing one. And hopefully we never will, as Dr. Walls was mentioning. And then of course, Joby Aviation. Not a lot of people are aware of Joby Aviation, and it's a Central Coast business, headquartered in Santa Cruz, but they looked at the Marina Airport as an opportunity to help grow their business, and they immediately saw the opportunity to help a community, and they haven't been asking for anything really in return except for the cooperation and collaboration and kind of the spirit of helping our community. So Joby Aviation stepping forward is a great indication of a business, a private public business cooperation and venture. So I want to thank them also. And the presentations today were spot on, and what the public needs to hear about as far as the work that goes on for the county in this time, and we're happy to be able to provide that. So thank you very much. And when the board gets a chance, then we would like to move into the approval of the resolution that you add as an urgency item, so that I'd have the authority officially from the board to negotiate and enter in any agreements with the city of Marina and Joby Aviation for use of those facilities for an alternative care site.
And if this is the right time, I make that motion, Mr. Chair.
We're not. I wanted to finish my comments on this item, if that's. I want to thank every single member of the county family who stepped up in these uncertain times to help bring forward answers. Often we hear questions in almost every forum and place that we are out there putting out information. What we hear more and more questions about what's happening here and there. And today, again, was not a regularly scheduled meeting. This was a special session. Folks were not a week ago thinking this is where we were going to be. We weren't thinking a month ago this is where we were going to be. But we're here the Tuesday after Easter, sharing with the community all the work that the county's been doing behind the scenes, along with partners. The county couldn't do these things alone. Working with partners like Joby, working with partners like Cal Coastal to bring forward opportunities for our community and those opportunities that they need at these times. So I want to thank each one of our partners. Obviously, it takes a lot of pressure to create diamonds, but there's so many people within our organization that have stepped up and become those diamonds through this. I especially want to call out our IT department. There's no harder time for them than, these were things we had projected out maybe in a year, maybe 2 years. In a few weeks, they figured it out, and I know that there's been some growing pains in that, but really we have some true stars in that department who are helping us get this information out to the public in new forums. Today, on a request right before we broke, we went Facebook Live with this meeting to help the community understand the efforts that the county is undertaking. So to those folks, I want to make sure you hear from me directly. Thank you. I really appreciate all that you're doing. So with that, we will head into the next item after we take public comment on the last item, because council gave me the look. So I want to open this up to public comment. I'll start with the folks in the room. Is there anybody in the room who'd like to give us a public comment on the presentations we just received?
Once again, I'm Pamela Weston. I'm the Access State Ambassador. I've asked for County Council, everyone to have coordinated comprehensive care. I've phoned over and over and over to the health department. They promised that they were going to work towards something. My request after this is, we've been doing engagement. The City of Salinas have been meeting with the different encampment leaders. We've done needs assessment. By what they say, we know that they're stable, but how that people get referred and the process of those cares and those units being used and the sites like Rodeo, if there is a way for those that aren't able to access internet, will there be a liaison with the engagement process that we've already started and the encampment leaders so that we can ensure that all underserved, unserved are able to be stabilized, recover, and have access to quality of care? Because now we'll have the facilities, but to mitigate and to actually measure the curve, that's my request, is to know how that Mr. Moreno will do a crisis management plan with an initial assessment now that we'll have coordinated ability and crisis response that deals with stabilization and access to quality of care. Anastasia was on the ground. She was looking around. We started to deal with sanitation and everything, but how we do it for the unserved, unsheltered, and most vulnerable targeted populations, that's what that we would ask that you work with a liaison between our engagement with the resident leaders and the city of Salinas as a model. Thank you.
Thank you, Pamela.
This is comment on the last 2.5 hours, correct? My name is Eric Peterson. First, I'd like to thank Supervisor Parker for her expressed concern for the most vulnerable in our society. It's been a while since we've talked about Connor Stapleton, paranoid, schizophrenic, alcoholic, homeless who lives on the streets of Seaside and Sand City, mostly because I haven't been here. But getting a roof over the head of somebody like Connor might save his life. Connor's a sharp guy when he's having a good day. He's 40 years old. He's been around a bit. And we've got a lot of others like him, and they've been seriously underserved in the past. And giving him a place to stay would be very, very helpful. Giving him a place to stay if he does get the virus. He's going to be really, really vulnerable to this virus, and as with others like him. I did have a couple questions for Dr. Moreno. I don't know if he's still listening. One was the age range of those who have been positive in Monterey County. The other was if he knows anything about a rumor that's circulating that I heard again just before coming in this room, that a mild form of the virus circulated in our area, and so a lot of us might be immune. I mean, don't take advantage of it, but and part of the reasoning behind that is we've got 87 positives out of 2,000 tested, and those numbers are a lot better than just about anywhere else. Thank you.
Thank you, Mr. Peterson. We'll go ahead and go to our Zoom function, see if we have anybody with their hand raised. Okay, so at this point, I have nobody with their hand raised to make a public comment, but I do have a request for additional comments from Mr. McKee. Was his hand still raised?
I put it down, but I just want, what I was going to say is I was remiss in not calling out some specific stars that have been happening. The contract purchasing office, the Office of Emergency Services and the EOC branch that they set up, and county council in particular have stepped up, tremendously in these efforts. And it's almost a nonstop piece of work that everybody's doing collaboratively. So I thank all of them, and I'm sure I'm missing a few departments and individuals, but thank you to everybody.
Thank you, Charles. Do we still have Dr. Moreno on the line?
Yes, I'm here.
I know that rumor of a herd immunity has had some other comments made to. I'm wondering if you care to address that at all. I know on the age range that report gets put out daily with the populations, but that question is one I was wondering if you'd like to take a minute to answer.
Sure. So yes, the information about the ages of confirmed cases is on our website, www.mtyhd.org. As far as the term you use, herd immunity, we know enough of the virus that there are people who have that are infected and were infectious who have no symptoms, mild symptoms, more severe symptoms and have died from their illness. So there are mild cases of it. I don't know that there's a mild virus unique to Monterey County, but people can be infected with the same virus and have a wide range of symptoms from it.
Thank you, Dr. Moreno. Now, I see we have some new public comments coming in via Zoom with hands up, so I'm going to go ahead and ask that Rolando Perez be given 2 minutes if Joel would unmute his microphone now. Okay. Mr. Perez, you should be able to speak now.
Thank you. I'd like to thank the Board of Supervisors and all the presenters today. My name is Rolando Perez. I'm a Salinas native and a PhD candidate in bioengineering at Stanford University. I'm currently back in Salinas and enjoying my time here with family, and I'm very impressed with our response here as a community. I wanted to ask around are there any comments from supervisors or others that presented today and thoughts around how Monterey County can lead in many other, in addition to the ways that we do in regard to our agricultural advisories and our response as a community to the pandemic, and how we might lead going forward into the future, touching upon Supervisor Adams' comments about how we can build a better future going forward with investments in education and infrastructure for things like biotechnology. I'm also the chair for a nonprofit based in East Salinas, Shinampa, that is a biotechnology nonprofit, and we're really putting forth our best effort by building PPE for farm workers, for instance, and we'd love to learn more about how we can get involved in these efforts.
Thank you, Mr. Perez. I now have another phone number that's but we don't have a name attached, but we're going to go ahead and unmute it. Would you give me the last three of that? It's a 747 number, so we're going to unmute your line now. If you'll identify yourself, you'll have 2 minutes to comment.
Hi. Hello, my name is Bruce Merchant. I live in South Carmel, North Big Sur, and I simply wanted to thank everyone who has participated on this call and everyone who has participated in these efforts to respond to the COVID-19 crisis. I was very impressed with the cooperation, the initiative, the innovation, and both within the county and all of the other organizations that are helping. And I simply wanted to pass on my thanks. That's all. Thank you.
Thank you, Mr. Merchant. Now, we do have 3 written public comments that I'm going to ask Mr. Pablo to read into the record.
Yes. So we have one public comment. It's coming from Maribel Ferreira. Can the health director answer what our county's compliance rate is with the shelter in place? When can we expect current orders will be amended, extended, or modified? The other public comment is coming from Betsy Stevens. On the neighborhood app next door, many residents have expressed concern over the inability to use gardening services during this time, except to do so in the event of an emergency. There are several seniors who are not physically able to clear their entryways, patios, and in one case, driveway of fallen debris. All residents, regardless of age, risk slips and falls due to the abundance of fallen leaves, limbs, and other natural debris. The City of Los Angeles is allowing gardening services to its residents, provided that masks are worn according to city guidelines. Many gardeners work alone and provide essential service to our community and properties. We are adults abiding by the guidelines for everyone's health and agree with most provisions of the order. I'd like to ask you to reconsider adding residential landscaping services, gardening maintenance to the list of business exempt from the current shelter-in-place order in place of Monterey County. This public comment is coming from Huff. Good morning, supervisors. We appreciate your invitation and hope to view this morning's meeting online. As a North County resident for over 35 years, we are quite familiar with how much attractive this area is to the Bay Area visitors and how susceptible residents and locals and our healthcare capabilities would be to COVID-19 brought in from more heavily infected areas. We also appreciate the devastating effects that recent COVID-19 migration actions have had on our hospitality industry and community businesses, and we empathetically ask supervisors to make sure any plan to relax them at this point include 1, some travel restrictions, 2, continued social distancing, and 3, programs to motivate county residents to support their community businesses and buy locally. Hotels, restaurants, tourist attractions, etc., could do this by offering county residents local discounts. Please discuss this item today. Thank you.
Thank you. Dr. Moreno, if you're still on the line, I think we talked to the loosening the hold or the shelter in place, but to the question about the compliance rate, is that a number we know today or a number we'll know later, or just something that we'll have to assume from an extrapolation of data over time?
I'm sorry, Mr. Chair, what was that?
The question from the public was about the compliance rate. Do we know what our compliance rate with your order is? Because obviously your charts were based off compliance rate. And so is that something we will know or something we'll have to wait to extrapolate later and figure out what it was after the fact?
So I think what I and we and other counties are doing is looking at these percentages and trying to identify which of these curves best matches our actual data in terms of hospitalization rates, because it's difficult to determine what percentage of individuals are actually adhering. There's a lot of, I guess, anecdotal and subjective information that comes in by our observations of how empty the streets are and how the freeways don't have too much traffic on there, and the kids are out of school. But we don't have a good way to answer the question, Supervisor. We don't have a established mechanism for identifying what percentage of the population is adhering. But we will, as time goes on, we'll have more data and more actual data from hospitalization rates, ICU admissions, and ventilator use that can guide our decision making.
Thank you, Dr. Moreno. With that, we will close public comment and we will move into item 6.1 that will begin with an intro from County Counsel Les Gerard.
Thank you, Honorable Chair, members of the board. This item was explained previously in the foregoing report. Just for the public's benefit, I would read the resolution. We would propose that the board authorize and direct the CAO to negotiate for and enter into necessary or appropriate agreements with the City of Marina and Joby Aviation for the use of certain land and facilities at the airport, that's the Marina Municipal Airport, as an alternative care site, to negotiate for and acquire necessary equipment and supplies to mobilize the alternative care site, and to cooperate with the county health officer and other appropriate healthcare professionals to mobilize and staff the alternative care site as may be necessary or appropriate. And finally, the CAO and the County Council are authorized and directed to take such other and further actions as may be necessary or appropriate to implement the intent and purposes of this resolution. The emergency proclamation by the CAO, which was ratified by the board, actually gives him the authority to do these things. However, board resolution is appropriate.
In light of the fact that I cut you off, Supervisor Alejo, would you like to make some comments?
No, I would just want to make that motion and thank Joby Aviation for being a leader, stepping up for our county residents in a time of need. And I think our county residents are not going to forget that when businesses step up, just like many other unsung heroes, I think they shine in this time of difficulty. And it shows that they're concerned and care for our residents and keeping them healthy if we're to get to a point where an alternative care site was needed. So hats off to them. Thank you.
Second.
So I have a motion from Supervisor Alejo and a second from Supervisor Parker. Is there any public comment on this item? See nobody coming forward in the room. Do I have any hands up on Zoom? Okay, no hands up on Zoom. So I'll bring it back and we will do a roll call vote.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye. Thank you. I believe that was the last item on today's agenda. Oh, they flipped the page on me. I have a referral. Okay, Mr. Gerard.
Thank you, Honorable Chair and members of the board. The last item on today's agenda is in response to a referral by Supervisor Alejo. It was on the agenda last week, but was continued. I've worked with Dr. Moreno on the language in the order, but Dr. Moreno has issued his own health officer order that does the same thing. In conversations with Dr. Moreno, he believes that the health order is sufficient. It does have the force and effect of law. In addition, it allows him to respond quickly to changes that come out of the California Department of Public Health, and they've actually changed their requirements several times since this referral came forward. So it's up to the pleasure of the board whether to go ahead and adopt this ordinance. I'd ask Dr. Moreno maybe to make a few comments.
Dr. Moreno?
Thank you, Supervisor. So I believe that the board is correct in recognizing that it's really important for laboratories to provide data on lab test results, both positive and negative, early on in an epidemic to get as much information as we can, and also demographic information that we might be able to use to determine, to share with California Department of Health and the Centers for Disease Control, who compiles all this data to determine which populations, if any, in United States, California, and Monterey County are at highest risk. And so we can take appropriate measures and plan accordingly. The referral to have that as a mandate within Monterey County, as County Council pointed out, there's a couple options. There are some counties, health officers who have ordered this, and Les Gerard and I looked at those, and a couple of them, and we're able to find a point, come to a point where the order my order doesn't conflict with any orders so far at this point with the California Department of Public Health and legal statute. And being a health officer order in Monterey County, we have the added benefit now of me being able to enforce it with laboratories at a local level. So we decided to go ahead and issue this order. And so I believe this should meet the needs of Monterey County Health Department, the county in general, to getting that information. And also giving, as Les Gerard mentioned, the flexibility to act quickly should different statutes be placed by our state policymakers, or if new direction comes out from the state health officer or the Secretary of Health or the governor, I and my fellow health officers who've issued similar orders can act quickly and amend the order.
Thank you. Supervisor Alejo, since this was your referral, do you
Yeah,
have comments for us?
Mr. Chair, I'm comfortable with withdrawing this request. This was prior to Dr. Moreno's order. The intent was just to make sure that we're signaling to our residents that we're getting all the broader scope of data that other Bay Area counties have already requested. And in light of Dr. Moreno's action, I'm willing to withdraw that. It's not needed anymore. There was two novel questions to this, though. It was these new testing labs that were giving waivers by our federal agencies to do a wider scope of testing. That I was wanting to ensure that was included in that any testing that goes on in our county, that this novel type of testing that Dr. Moreno and our health department would get access to it. The second was just making sure on the racial data that we're also receiving that, because as we've seen in other parts of the country, we're able to see that certain minority or communities of color are being more adversely impacted by this disease, whether it's a lack of testing, a lack of treatment, or other disparities in their communities. All these data points help us better measure and whether it's predicting or serving and predicting where this might spread or communities that may be impacted. For so many reasons, we need this. So if Dr. Moreno could just answer those 2 points about capturing these new forms of data, testing that are going on, and just racial data, because I'm not clear whether that comes from the labs or it comes from other healthcare providers that obtain that data for us to use as a measure.
So certainly I can answer try to answer those questions. So as far as the new testing, I checked with Donna Ferguson, who's our Monterey County Public Health Lab Director, and she confirmed that these new tests that are arriving to healthcare providers are the type of tests that are included in this order. They have the equipment is made from different manufacturers. The testing material, the reagents may also be proprietary, but they're still using the type of technology that's included in this order. The order also includes, so that's trying to identify the virus itself, which was part of the presentation today. The order also covers serology tests that can be, that are approved, meet certain approval requirements, and those also have to be reported. And the benefit, I mentioned the benefits to I think the more longer term benefits of having serology testing results available to us in my presentation. And then as far, so the answer there is yes, Supervisor, they're covered. And then the others on race and ethnicity data. The state of California has a template for the confidential morbidity report that all providers have to fill out when they are reporting certain diseases, which include COVID-19. And I believe the, let's see, well, actually, no, I know that when we're entering this, when we receive this information from the providers and from the laboratories, we actually have to put it into the state's, the California reportable disease system. And so we're getting that data from the providers. If we don't get it from the providers, we get it from the laboratories. And if for some reason the providers and the laboratories don't obtain that data to give to us, our disease investigators, when they contact the people with confirmed COVID-19, they're getting that information directly from the patient. So we are getting all that information.
Thank you for that clarity. Thank you, Dr. Moreno, for your actions on this.
Thank you, Supervisor Alejo, for initially putting in this referral. I know I share your concerns at the time. There was a lot of information our community was asking for, and we saw other communities move first. But thank you for spurring some action. I really appreciate it. Are there any other board members with comments on this item? Joel? Okay, seeing no hands up, I'm going to go to public comment on this. I do have one hand raised. That is Rolando Perez. I'm going to ask Joel to unmute your microphone. You'll have 2 minutes.
Thank you again for letting me speak. Supervisor Alejo, thank you so much again for once again leading and asking the very difficult and informative questions, and Dr. Moreno for your excellent work in this very challenging time. I have a question for Dr. Moreno in regards to the modalities, the changing landscape of CLIA and emergency youth authorizations. And from my perspective in the research lab, things like sequencing modalities and CRISPR modalities that are coming out, and what is our outlook on that horizon? And also with regard to the data that we do get in terms of racial demographics, and what I'm seeing, and very thankful for the transparency from the county in terms of reporting this, the data on positive cases, recovered cases, which I really think reporting recovered cases, I'm very grateful for, because that can be a boost to morality for the community. But I would also ask if it's possible that we report our death rates, our recovery rates, and our positive rates broken down by racial demographics. And this isn't an effort to stir any kind of community unrest, but just to really get down into the epidemiological dynamics. We know that there's ongoing research into the potential underlying effects of genetic predispositions for viruses like coronaviruses. And then one last thing with regard to serological testing, and being very clear that there are again, you pointed this out, Dr. Moreno, in your presentation, but false positive, false negative rates, and being very clear with the community about these false positive, false negative rates, and also the data that we do get with regards to the conventional testing of reverse transcription, reverse transcriptase, quantitative PCR-based testing, that there is limited detection. There are positive and negative rates with regard to sample prep and sample acquisition. And thank you again.
Thank you. Ms. Weston also had some public comments for us.
in determining the social determinants of health and dealing with mandated testing and dealing with the jails and prison and in dealing with social impacts, with this resolution not be put in place from a state and federal and local level, how will we do different? Because we've already done a lot of work around equity, but in dealing with transparency on how we move forward, on whether mandated testing is going to be in place, and in the concerns for those that have loved ones and family in the institutions like that I've mentioned, prisons and jails and systems. Will there be work and resolution done more on a local level with our local prisons and states, because it's been a concern. So I just wondered with Dr. Moreno how he's going to do things different in regards to our disparities and inequities.
Thank you, Pamela. So there were some questions there for Dr. Moreno, and I know that those are some deeper dive questions. So we'll ask that perhaps Dr. Moreno approach those people with those questions offline. I know that some of those would take a lot longer answer than time we have right now. So I'm gonna ask that we take that method in responding to those public comments. And with that, I'm gonna go to County Council and see if there's any additional information needed.
There's no reportable action in closed session, Supervisor.
Thank you. We voted on this. Okay. Yeah, so it was withdrawn, so there was no. Okay. All right. So with that, we're going to close that item. There was no report out of closed session, and with that, our board is adjourned. Thank you.
Good job, Chris.